Hello, everyone. Colleen from Chronically Spicy. I am on episode 3 for rabbit hole researching on making sure I spell out every single allergy that I have because I've got a lot and I've got a lot of rare stuff going on. I'm every doctor's worst nightmare and some future researchers' dream case study, probably. So here is the TLDR update to catch you up if you haven't watched episode 1 or 2 of Rabbit Hole Research for the Live rewatch. I am currently trying to basically stupid proof my allergy list for my current and future doctors because there's going to be more doctors because I just got when we were I just found out by going in my records from Mayo Clinic from 2024 that I have something called macroglobulinemia, which is a rare form of chronic blood cancer, slow progression. It's treatable, not curable. But of course, with my medication allergies, finding what I can take out of the options is going to be something that I have to be very aware of because latex allergy, coconut allergy, ethylene chloride allergy, those allergies make me allergic to pretty much almost all medications, including corticosteroids, antihistamines. I can only do intramuscular diphenhydramine, and epinephrine, and an anti-anxiety medication that also works as a mast cell stabilizer, but a lot of doctors who aren't mast cell activation syndrome aware just think that I'm, looking for a good time. Trust me, I'm not. I'm just trying to survive the weekend. Anyway, apparently having ethylene chloride as my allergy listed on my allergen list, which before I started trying to itemize everything, was the total was 832 allergies. Now that I am stupid proofing the list and adding everything, as in every single corticosteroid, every single antihistamine, every single and coconut allergy, and every single, basically every one of them. I'm just trying to put every single one of them down. So 846 is going to go from 846 to, hi, I have so many allergies that they come with a comma, which is absolutely not a flex. Trust me on that. Hey, Vesper. Right. Okay. 1 second. Ready? I didn't say it. Capillary refill. Hey, that guy, how are you? Yeah, I've got a whole bunch of new stuff going on. Really? Okay. Capillary refill. That's slower than last time. But I also haven't had any of my mast cell stabilizing med today because I only have enough to get me through the next, let's put it this way, instead of 3 times a day, I have at the dose that I'm supposed to be on according to the Mayo Clinic, who I'm actually really pissed off at right now, and maybe looking into calling some lawyers, we'll see, for not telling me, hey, by the way, you might want to talk to your doctor about abnormal labs because there's some things that are showing up that are, could be very concerning. They could have been that vague and had me print out my labs and take them into my doctor and be like, what's all this mean? And that guy, yeah. So Mayo Clinic, 2024, diagnosed with everything from fibro to EDS to Behçet's disease, autoimmune condition that causes your body to attack its own blood vessels, can cause stroke, seizures, aneurysm, blood clots, etc. And makes my skin get really hard and calloused, and changes painful. Skin cracks. This is from yesterday. Hands get like super swollen and pain, and like feels like a volcano getting ready to explode. I don't know how else to explain it. And so there's that. And then, oh, that's also triggered by mast cell activity. So when my mast cells are stable, that condition is actually under control. But my doctors don't believe, my current doctor doesn't believe or know, I guess, what I'm saying. And I'm not sure at this point if it's smart to bring in the NCBI, NIH, and all other references that I have proving that it is used as an off-label, the medication, I mean, off-label mast cell stabilization control for people who can't, who can tolerate it and maybe can't tolerate others, which I can't. I'm literally allergic to all other corticosteroids. I'm allergic to all other all corticosteroids, all antihistamines, Benadryl I can take, right? I can't do anything else. So H1 is Benadryl. That's it. I was taking loratadine as my H1, Claritin. I didn't know that it's epipirazine. Piperazines are on the no-no list if you have ethylene dihydrochloride allergy. That's my base allergy. That makes me allergic to latex. And I'm independent allergic to coconut. So if I'm not allergic to medication for one reason, I'm allergic to it for another. I had an MRI done at my local hospital health system and 4 days ago. And guess what? Hospital scrub caps, they're made of coconut fibers. The little squeeze ball they give you when you're in the MRI machine, so that you can like squeeze it if you're having a panic attack or you need to get out right now for whatever reason you're having issues. They knew about my allergies a week before I got there. And I talked with the MRI tech that was going to be doing the procedure. He even had me come an hour early so I could look over everything. And I'm like, he's reading the ingredient list for the saline and the contrast dye and gets to propylene glycol. And I'm like, yeah, that's a coconut allergy cross. That's a coconut allergy derived ingredient. He's like, huh. He's like, I had no idea there's so many different names for coconut. I'm like, that's just one of them. There's like 300 plus. And I know all of them. And he's like, well, I mean, how else are we going to, I'm like, this is why I asked for this to be done on the hospital side. Yeah, it's, 20 feet down the hall. But like, this is why I asked for it to be done on the hospital side with an IV of Benadryl running the whole time, so that my system would have something to compensate and basically at least try to keep me stable while that was happening, because it's one of those, you need to do it because they can't see. I have a pituitary gland tumor also. It's benign. It's called a prolactinoma. Mine, according to the Mayo Clinic, it is a macroadenoma now, which means it's big enough. According to the Mayo Clinic labs, it's big enough to cause issues like seizures, slurring, and potential blindness if it presses on the optic nerve. But in the MRI, so that's why I was getting the MRI. But here's the problem. Oh, I got my goal. Cool. Thank you. I totally missed that. Whoever did that, I'm sorry. Thank you for that. So he's reading I'm like, scrub cap. I didn't know that till I got home. Okay. I just knew my hair changed textures completely during the, my hair went from I went from, okay, I'm not aware of the hair on my head to being aware of every single follicle on my head and not wanting it touching my skin, which told me this isn't a good idea. Like, I asked if I could keep my own hair wrap on, because I purposely dressed in clothes that did not have metal in them so I would be safe in the machine. And didn't think to try and talk to them beforehand about that because it just didn't occur to me. Because and I'm like, no, they're like, no, you have to change into, the hospital gown and a pair of shorts and, rubber grippy socks and blah, 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 blah. I'm like, I'm not wearing the socks. I'm allergic to laundry detergent. Real, like, actually, I will react to that too. So, and the MRI squeeze thing for, like, getting out, the, Pasco Now, a squeezer, uh, this is this is when I knew I was and I just resigned myself to trying my best to stay. I did pre-treat because they weren't going to pre-treat me or treat me with anything there since it was not on the hospital side, right? This was just coming for basic MRI, and I'm like, yeah, I'm not a basic patient, but okay. And so I was just praying that taking what I had my medication prior to for pre-treating, like I would if I was going to a new restaurant or I knew it was going to be a super busy day, or I wanted to have, I wanted to exercise or do anything that was going to raise my heart rate, which is what I used to do, but I can't do it now because I'm rationing my meds. I only get one a day of my medication. I used to be on 3 a day, and so I have to break that one up into like 3 pieces, which means I'm basically chasing after a forest fire with a doll-sized watering can, a flower, flower watering can, and just hoping to put some of the fire out, but I can't, like, keep the fire from starting anymore. So again, I see a new allergist on I was referred to an allergist, and I see him on Tuesday, and I don't know anything about this guy. He's the only allergist that I have found, that will see a mast cell activation patient in the state of Wisconsin or Minnesota. Even the Mayo Clinic will not see mast cell patients. Every single allergy facility that I've called, independent clinics and offices with allergists in them, I start off with latex allergy, coconut allergy, avocado allergy, banana allergy, wheat allergy, ethylene dimethylchloride, anaphylaxis too. I list the ones that cause anaphylaxis. This is why I carry because this is why I carry 4 EpiPens at all times. And they're like, all right, and you can hear them like, all right, let's going through the calendar to get me on the books. And the second I say, I also have mast cell activation syndrome. The furious scribbling and page turning you hear on the other end stops, and they go, yeah, we don't take MCAS patients. I'm like, can you just pretend that I didn't say that? And they're like, no, because we'd see it in your records. So we don't do MCAS patients. Makes 0 sense, because I know other people with same conditions that, I'm trying to advocate that guy, but it's hard. Let me talk in code here for a second. It's hard to advocate for a medication that you know works for you when you are allergic to everything else, when the medication that works for you happens to be one of those that are classified as controlled. Because then you just look like you're hide and seeking. And while any other patient who's trying to find the right doctor for their family and their medical needs, who isn't chronically ill, or maybe they are chronically ill, but they don't have like all the extra weird and stupid shit I have going on. That's not doctor shopping. That's just being a responsible parent so that you can look for the right doctor for you. I get accused of doctor shopping. You were diagnosed with type 1 diabetes since the last time we talked. I'm glad that you got that answer, because type 1 that's not something to play with at all. Type 2, yeah, that can be controlled with lifestyle changes and everything, and go into remission if you stick to what you're supposed to do. But type 1, that's something that you definitely need to make sure, because that's not something that you can reverse. You have to just live with it. I was also diagnosed with a macroglobulinemia, which is a rare type of chronic blood cancer. I guess you could put it in the same category or similar category as like indolent systemic mastocytosis, where you can't cure it, but you can treat it, right? Most people aren't diagnosed with macroglobulinemia. Oh my God. Saying this condition can make anybody sound like they're not sober. Macroglobulinemia. Waldenstrom macroglobulinemia. Every time I think I'm adding extra syllables. Anyway, it is, when I say rare, I would have to be like on like a countryside field. Picture The Sound of Music with Julie Andrews singing, except there's no Julie Andrews. There's no few of my favorite things. There's just like a million people, literally a million people standing with you. Out of that entire group of people, out of the entire million, it would be me and max 3 other people who would have this condition. It's 3 to 4 out of every million. And it's a form of non-Hodgkin's lymphoma. And basically, if you've seen any of the ads on TikTok or YouTube or whatever for like the Roundup weed killer lawsuits, this falls under that category. So that's, yeah. All right, so let's get into, hey, Joanna, no banana. Everybody follow. If you have mast cell, POTS, EDS, and you're looking for another source of reliable information and like first person shares for insight on how she deals with her chronic illnesses, you should follow Joanna No Banana. Here on X, I think if you're still on X, I'm not sure, and Instagram, and I believe she's also on YouTube. By the way, if you're watching on TikTok, please hop on over to YouTube. Please follow, subscribe, and help me get up to 1,000 subscribers on the YouTube channel. That would be extremely appreciated. And then you can watch the screen share, actually. Okay, one second. I have to go to the screen share and add a, sorry, I have to go to the, now we can add screen share. All right. So we are now going to start researching. If you want to catch up on where we were versus where we are, for my allergy list, I was at 832 allergies before I started breaking everything down and basically trying to stupid proof it, to the point of, putting the label on the label for a baby onesie, remove baby from onesie before putting it on washer. That's essentially what I'm trying to do for my doctors, because none of them know to actually cross-reference any medication for allergies. I'm starting to wonder if that should be like a service that I offer, like allergy auditor for like medical facilities where physicians just don't know, oh, you're allergic to latex and you have a condition that needs to be treated with colchicine, which is a corticosteroid. yeah, we can't put you on that because colchicine is derived from crocus flowers, and crocus flowers are in the same family as latex as an afro latex tree. So it's a latex allergy cross. You're not going to know that unless you need to know that. I need to know that. And that's the first line treatment for Behçet's disease. If you can't take colchicine, you can take other corticosteroids if you're not allergic to the entire class, which I am, because of ethylene dihydrochloride, which is also used as a stabilizer in natural latex, and that's what makes me allergic to latex. So it's ridiculous. It's absolutely ridiculous. All right, so let's see. Let's look at the. All right, so last time for corticosteroids. Okay, made with ethylene dihydrochloride, coconut allergens. Okay, we've got everything from Atarax to prednisone to depomedrol to glucosteroids, etc. And triaminoquine, prednisolone, Orapred, and a bunch of other medications listed under the corticosteroid family. Now we're going to be looking at antihistamines. All options allergic due to, and I highlighted, or I bolded in all caps the subhead for this one. Antihistamines, all options allergic to due to ethylene dihydrochloride per Henry Ford Medical System Testing and dermnet.org. So to basically stupid proof even further, I'm going to have to print out my medical records from Henry Ford because I was diagnosed 18 years ago. And yeah, that's going to be fun. All right, so let's look up antihistamines now. And let me find. And after I finish looking up, and I'm not doing all of this tonight because I'm going to do more. I'm going to try and finish up tomorrow. So there'll be at least an episode 4 for rabbit hole research for allergies, MCAS, and chronic blood cancer for treatments, because the secondary thing that I'm trying to accomplish by updating this list is making sure that when I get to I don't know if my internal medicine doctor's going to be handling this or if he's going to refer me out, but this is basically what I'm trying to do is make sure that any doctor who I do see sees all of the allergies that I have for treatment options and which treatment options might be safe for me to use or be prescribed. All right, so we're looking at antihistamines now, because let's find a good, one second, we're going to screen share this while I'm here so that people can see if you're watching on YouTube. All right, so screen share. All right, so I'm screen sharing while I search, which is what I would like to do if anybody's interested in, like, anyone who says that for Patreon or on subscribe, because the things that I can't post publicly over there. I would be bringing, like, real time research and helping you gather the information that you need to gather to take to see your own physician, and have like the NCBI, the NIH, Medical News Today, JAMA, and everything like that, right? So let's see, antihistamines, trying to find a reputable list. Okay, so we're gonna go to this one. Note list of common antihistamines. Let's just go to dermnet.org. And so yeah, the macroglobulinemia is treatable, the chronic blood cancer. Most people aren't diagnosed until they're like 65 is the average. So I've got a 20-year start, essentially, head start. But I have to find which option is available for me out of the few that are there. The most drastic is stem cell transplant, which is like the least often used or recommended. I'm guessing because it's the most invasive and probably stupidly expensive for insurance companies to cover. So I have to see what options I've got. So, hello. Okay, so let's look for, right, antihistamines. All right. Where's his DermNet? Let's just go to. All right. If you join on YouTube, you'll be able to see the screen shares with the information that I'm looking up. All right. CDI, Allergen, Contact Dermatitis Institute. We'll go here. Wait a minute. DermNetNZ.org. Let's try this one first. CD allergy, share this instead. Okay, cool. This is the one that I use all the time. So I'm showing the reference information page for ethylenediamine dihydrochloride from the Contact Dermatitis Institute. And you can see the screen share on YouTube. So let's make this bigger. And actually, let's go over here and adjust so I can make myself smaller. And how did I do this? To work full. Okay, so let's do it this way. There we go. Now I'm here too. Okay. All right. So the list of allergens. Okay, so ethylenediamine hydrochloride, a substance that is used to manufacture various drugs and industrial compounds. The most common source of allergic reaction to ethylenediamine dihydrochloride is contact with topical antifungal, antibacterial, and cortisone skin cream mixtures, especially those containing nystatin, rarely found in cosmetics and toiletries. Ethylenediamines are one structural class of antihistamines and was used previously as a stabilizing component in topical medicaments such as Mycolog cream. It's used in every single topical medication that I have found. It's used all lotion, all skin creams, all shampoos, all conditioners. I've had so many doctors like, yeah, you need you have your scalp is completely irritated. Here's a steroid cream for that. It's so common for patients to be diagnosed with this allergy and then be sent home with medications, topical medications, and medications you take internally. That on the same day you're diagnosed and you're sent home with multiple medications that contain the allergen. It's so common that it's actually mentioned in one or two of the medical journal articles that I've found since while researching this. So this is not just a me thing. All right, so because you're allergic to ethylenediamine, you may have a general skin reaction to antihistamine drugs used in the treatment of asthma, hay fever, motion sickness, and hives. I get a hellfire rash that like nothing, I can't have anything physically touch it because it burns like fire. And here's the thing: if latex allergy is progressive, this allergy, I believe, although I don't see it stated anywhere, I believe it's progressive also. And this is just me nitpicking, but I've always thought that contact allergies were like you touched something, so you have a skin reaction to it. Like when doctors get rashes on their hands from wearing gloves because they're in surgery all day. It doesn't matter if it's latex gloves or nitrile gloves. And here's hoping it's not latex gloves because that's the patient's health as well. But they get rashes, right? I used to get rashes from like rubber bracelets and rubber like watch straps when I was like in high school. I didn't realize that but that's contact allergy. That's what I thought it was. So when you take something internally, like if I eat an avocado and I break out in welts, no one's calling that a contact allergy. That's anaphylaxis, right? It's an allergic reaction. So I have a little bit of a sticking point for me. A variety of industrial products such as epoxy resins, coolant oils, fungicides, dyes, insecticides, and synthetic waxes also may contain this chemical. When I say synthetic waxes, that also includes, from my personal research and experience, medical waxes and lubricants also. So anything they have to spray or put on the like tubes and scopes that they put down your esophagus for like say upper endoscopies when they're being intubated, etc. Those are going to contain ethyl and diamide chloride as well. I had my airway slam shut the second they got the scope down past like here, right? Right into my, it had just gotten into like past the tonsils area and my airway slammed shut. I woke up like 20 minutes later in the recovery room and the waiting room and whatever. And the doctor was like, yeah, we had to stop the procedure because your airway slammed shut and we had to initiate rescue. So, don't worry, come back in 2 weeks. And the anesthesiologist knows exactly how to handle this now. And I'm like, sure. I didn't go back. All right. So we're looking specifically, this is a very long list of stuff here, but we're looking specifically for, let's see. All right. Oral, intravenous, or intramuscular medications. I'm going to be copying all of these and putting them on the list here, which I know is not going to be, here we go. Ethyl allergy, all options allergic due to, not to do. All right, so Contact Dermatitis Institute. Let's change that too. Doctors don't like, I've learned, where they expect a patient to be aware of why they came in. You have symptoms of strep throat. You're having an allergic reaction to a medication you took, and you don't have any other allergies. Your child might have croup or an ear infection, and they're asking for symptoms and all this stuff. They want you to be able to share why you're there, right? So that they know what to look for. But they don't like it when somebody like me comes in and like knows things. I have to know these things because this is how I know what to tell doctors, which is I can't take that. When they say this is what you need to take. But no, I just know too many medical terms. Okay. All right. So, all right. So we're numbering this, right? So we were at 846. So I want to make sure I do this. 847. So immunophilene, oral and IV form of theophylline, cyclizine. One second. That's the next one. Cyclizine, 848. Hydroxyzine. My daughter's been on this one since she was 2 because of severe allergy, mast cell activation syndrome and severe allergies to, we didn't know that's what it was at the time, but severe like seasonal change reactions. Her hay fever would send everybody else to like the ER. It's pretty crazy. If you just joined, I'm over on YouTube live streaming, so you can actually catch the screen shares and watch what I'm sharing as I find it, because this is happening real time, because I have a new allergist appointment on Tuesday, and I need to stupid proof the list so that nobody puts the baby in the washer with the onesie, right? Because that's on the tag. Because, so that means somebody did it. Let's see. All right. Antihistamines classified as ethylenolamines or piperazines. Yep. All right. We're at 850. 851. Buclizine, buclidin S. 850. Cetirizine. 852 is cetirizine Zyrtec. 853 is, one second. I can't believe this is going to have freaking commas and a comma when I'm done. 853. Chlorocyclizine Mantidil. 854. Prochlorperazine. 855. Thiothixine. Okay. 856. Levocetirizine, Zyzel. 857. Promethazine hydrochloride. I had a compounding pharmacist accidentally send me home with a box of promethazine intramuscular instead of intramuscular diphenhydramine one time when I lived in Georgia. It looks like the exact same box. I didn't think to. I always read the labels now and make sure I'm like, it didn't screw. Okay, cool. Because injecting that into my muscle felt like I had a flamethrower, and it was concentrated in this one little tiny syringe, and oh my god, it was the most painful experience. Okay, and he was so sorry. All right, 858. What is Phenergan? Hi, Joel. How are you? 859 is triple-enamine, PBZ. 860 for the number of allergies is trifluoperazine. All right, that's those. Okay, so now we go back to the list and we check, because this one I don't think has, we're going to add this too, topical medicaments. Now, all of these, of course, are not right here. So topical medicaments, right, from the Contact Dermatitis Institute, right? Hey, Maddie. Everybody follow Inconsistent Systems. Incredible source for MCAS information. All right, so let's go back to the list here. And we are 860 allergies. Some of these are repeat allergies listed because I have them under multiple categories because, again, I'm basically trying to stupid proof the list. Okay. Like, nope, that's on the allergy list. And if the allergist says, well, we need a drug test or challenge for any of these, I'm going to say no. Wait, promethazine, here, share this. Okay. So I'm sharing the list I'm creating on screen share on YouTube on Chronically Spicy. No, according to Henry Ford and according to my allergy testing from 18 years ago, this is not an allergy that you can outgrow. This is not an allergy that you can challenge, that can go away or fade with time. If you're allergic to it, you're allergic to everything on the list. Like, this is not like latex allergy is one of those where, like, okay, we're all allergic to, if we're allergic to latex, you're allergic to latex, but it doesn't necessarily mean that you're going to be allergic to bananas or avocado or jackfruit or stevia or monk fruit, or you might even be able to wear regular, everyday, don't got to look at the brand, rubber-soled shoes. You might be fine wearing underwear or shapewear that's made with spandex or elastic. You know what I'm saying? Like, there's a lot of like variation in where people are with allergies for latex. Ethylene dichloride, if you're allergic to that, you are allergic to everything on the list. Big Step Certified says, can you be allergic to stuff with a low eosinophil count but high neutrophil count? I think I would have to ask. One sec, let's look that up. High neutrophil. What to know about low eosinophil levels from medical news today? Eosinophils are a type of white blood cell. Low eosinophil numbers may indicate excessive stress, alcohol misuse, or the presence of an underlying condition. Eosinophils play a role in the immune system by helping fight bacterial and viral infections, and can also play a role in the inflammatory response to an allergen. I have very high leukotriene levels. That's how my MCAS was officially confirmed at the Mayo Clinic. And so my C-reactive protein level is ridiculously high. And it also contributes to my Behçet's disease. A doctor can check eosinophil levels using a complete blood count, CBC, or WBC count, white blood cell count. Eosinophil count refers to the number of eosinophils in the body. Most adults have an upper limit of roughly 500 eosinophil cells per microliter, or UL of blood. Higher counts can indicate the presence of an infection or other issues. When a test reveals a person has a higher eosinophil count than expected, they're likely they have a condition known as eosinophilia. Lower numbers may indicate potential health problems. When a person's eosinophil levels are low, they may be at an increased risk of certain health conditions such as heart failure. That's from Medical News Today. And then, let's see, what causes... Let's look up high neutrophil count. All right, so top 5. Nope, we're not looking for supplements, so I'm not trying to do an ad. What does it mean when your neutrophils are high? This is from eMedicine Health. Possible roles for neutrophils in allergic rhinitis are revealed. That's from an NCBI article. But let's look at e-medicine for this one. Share, and then I'm gonna go back, and then I'll go back and finish my list for the antihistamines. That's what I have to find still. What does it mean when your neutrophils are high? Neutrophils, type of white blood cell that helps the body fight infections and heal injured issues. So if your eosinophil count is low and you already have and again, I'm not a doctor. I'm not giving medical information or medical, diagnoses or anything. Or advice. I'm simply sharing the research that I am doing and able to do. I'm a lifelong reporter. Big Steph, thank you for the likes. I appreciate it. I'm gonna follow you because I appreciate it. And I'm a lifelong reporter. I've been published in Men's Health, Washington Post, Red Book. I used to be Latina Magazines when that magazine was still being published. I was their love, SEX, and relationship columnist. I had 11 million. I think I had 11 million combined readers between the website and the printed magazine. And I've written for Huffington Post and a bunch of articles on like mental health and stuff. You can if you want to check out my bio, I've got my writing portfolio link there on my link tree. All right, so now you're talking about low eosinophils already mean high inflammation and the likelihood of high inflammatory conditions and other conditions that are going to be triggered by having high inflammation, which is not a good place to be because that's stress on the body, stress on the cardiovascular system. And neutrophils, being a type of white blood cell, helps the body fight infections and heal injured issues. So if you have low eosinophils and which means high inflammation, and your neutrophils are high, then it looks like it helps the body fight infections and heal injured tissues. Okay, let's see. Neutrophils are produced in the bone marrow, and they make up 55 to 70% of the total white blood cell count. Okay. What is a normal neutrophil count? An absolute neutrophil count, ANC, blood test may be ordered along with the complete blood cell count, CBC test. This is from emedicinehealth.com. All right. And you can see and follow along with the screen share on the YouTube channel. I'm live streaming there, Chronically Spicy. So an absolute neutrophil. Okay, so the differential. Low levels of neutrophils are below 15 MCL or less than 45% of the total white blood cells. Okay. Sorry. Fun with Mastel. If levels are between 10 and 15 MCL, it's considered mild. If levels are between 0.5 and 1 MCL, it's considered moderately low. Levels of less than 0.5 MCL are considered severely low levels of neutrophils. What does it mean when they're high? That's what we need to know, right? Well, high levels of neutrophils in the blood are called neutrophilic leukocytosis. Sounds a lot like leukotrienes, doesn't it? Or neutrophilia. I'm just saying that the words are similar. I'm not saying that I haven't looked into that to see if that's actually like a base situation with my high leukotriene levels, just to make that clear. Causes of high levels of neutrophils in the blood include infections, bacterial, viral, and fungal, inflammatory conditions such as rheumatoid arthritis, inflammatory bowel disease, IBD, Crohn's disease, ulcerative colitis, chronic hepatitis, vasculitis, Kawasaki disease, adult Still's disease, granulomatous infections, bronchiectasis. Oh my God. I'm sharing. So this one here, bronchiectasis. Why are there so many of these words and so many consonants? Oh my God. Bronchiectasis. There. Certain medications, catecholamines, glucosteroids, myeloid growth factors, plexifor, lithium, atra, beta 2 antagonists, epinephrine. Okay, so you don't want to know how many EpiPens I go through a week. You don't. And it's not because I want to. It's because, again, I am not properly medicated at this point. And my options for treating MCAS reactions and anaphylactic reactions from diagnosed confirmed allergens are literally, I have to go straight to Benadryl and Epi. I don't have any other options. Okay. Smoking tobacco, stress, exercise, heat stroke, surgery, seizures, emotional stress, obesity, seizures again, endocrine disorders such as thyroid storm and hypercortisolism, pregnancy associated conditions such as eclampsia and postpartum state. I had preeclampsia, so I actually had to have an emergency induction. So she was born. Basically, she was a preemie by like 36 hours or so. Because 17, 18 years ago, the full term was 36 weeks, I believe. And at 35 weeks, they were like, your blood pressure is 200 over 100. You're going to be going into the hospital to have the baby. Like, call your husband and go to the hospital. And I'm like, but the nursery's not done. And I just didn't know. All right, so there are certain cancers that are associated with high neutrophil count, including chronic myeloid leukemia, juvenile really? All I can drink is water, okay? And I can't even drink water that's like carbonated because I'm allergic to that too. So, juvenile myelomonocytic leukemia. If you're, I would highly recommend watching on YouTube because I know I'm butchering some of this stuff. Like, wow, like I can read them in my head, but like my tongue's like blah, 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 because there's just what? Okay, other myeloproliferative neoplasms, polycythemia vera, essential thrombocythemia, chronic myelomonocytic leukemia, and chronic neutrophilic leukemia, non-hematological malignancy, genetic disorders such as Down syndrome, leukocyte adhesion deficiency. Yes. We were at the ER last night with little miss because she has chronic like cough asthma, and she's basically been sick and down for the count for the last month with just constantly needing to use her rescue inhaler and nebulizer. And yep, I have I have macroglobulinemia. That's what it's called. It's a rare cancer, rare chronic blood cancer, slow progression, treatable but not curable, mostly diagnosed in people who are 65 or older, and most people who are diagnosed, considering the fact that most people are diagnosed at 65 plus, most people are alive 10 years later. But and it affects 3 out of 3 or 4 out of 1 million people. Is it MDS? My dad had that for stage 4. What is MDS? So I can look it up. See, injuries, accidents, surgical. All right, that's not helping me. Let's look up neutrophils and allergies. It took him out because his body couldn't make blood cells. MDS is a type of blood cancer. Okay, all right. It's a form of non-Hodgkin's lymphoma. Macroglobulinemia is a form of lymphoma, but it's again, I'm not sure what the average, what the percentage of people who are affected with lymphoma is, non-Hodgkin specifically. But I know that this is a subset that, like my eyes actually, there's not a lot that I can actually find in medicine when I'm researching that makes me go, excuse me. But yeah, this one, my jaw dropped when I'm like 3 out of a million, out of every million. That's insane. I've got like an incredibly high number of white blood cells. My white blood cell count has been super high since she was like 5. So let's see. Neutrophil recruitment by allergens contribute to allergic sensitization and allergic inflammation. So there you go. If you've got allergic inflammation, your eosinophils, according to, I'm just following the puzzle pieces here, right? Following the breadcrumb trail. If you have high neutrophil and you have allergic sensitization, it's going to cause allergic inflammation. So if I'm always in a state, for example, of chronic low level anaphylaxis, I'm going to obviously be inflamed, and there's only one medication that I can take that keeps that from happening, because when my mast cells are active, which means they're pissed, that also triggers. You sound like shit.
Wow, it's almost like I knew that.
Yeah, 1 second. 1 second. Where are your medications so I can open them and take them?
I already took.
Yes, but you'll also need to take your hydroxyzine and your cetirizine and a famotidine. Yeah, we were at the ER last night, so and then she got prednisone, because she's usually only down for about 5 days when the seasons change, and she's usually only affected in the summer, spring and summer, like when things are alive. She was fine when we were in Georgia, mostly.
Literally, life does not agree with me, apparently.
I'm the same. We're both allergic to existing. Okay, so let's see. So, purpose of review. Recent findings. Uncontrolled asthma is associated with elevated number of neutrophils and levels of neutrophil attracting chemokine, IL-8 and IL-17 in BL fluids. Parameters negatively correlate with lung function. Pollen allergens and cat dander recruit neutrophils to the airways. Blah, 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 blah. Molecular mechanism by which neutrophils shift the inflammatory response of the airway to inhaled allergens to an allergic phenotype is an area of active research. Summary, because we're not reading the whole thing. Recent studies have revealed that neutrophil recruitment is important in development of allergic sensitization and inflammation. Masto, for like specifically what, Joel? Recent studies reveal an inhibition of neutrophil recruitment may be a strategy to control allergic inflammation. So if you have high neutrophils and you're allergic to something, the basic idea from what I'm seeing here is talk to your doctor about the best option for what treatment might help to control your allergic inflammation, specifically your neutrophils. Which should then, if I'm reading this correctly and following the breadcrumb trail properly, by correcting or lowering your neutrophil load, that should help to stabilize the scales so that your eosinophils balance out too, right? That's what I'm seeing. So hopefully that helps. But yeah, it's an issue if you've got, like, asthma is definitely one of them, and right now her asthma is completely uncontrolled, and it hasn't been this bad since she was like 18 months old. So she's been referred to an allergist, and she is on a 5-day 5 days of prednisone, and I'll be calling her pediatrician tomorrow. I'll be sending a message in the patient portal to let I mean, she'll see it, but let her know, yeah, we were in the ER. Asthma completely uncontrolled. She is almost 18 and is very like hyper aware of her body, and obviously with chronic you have to be. So she's able to tell me when something is working for her. Oops, here we go. Sorry, I forgot to share that. This is the page for the neutrophil and allergy one on asthma. But she was she was doing her doing a nebulizer albuterol session, and moves her mask for just a second. She's like, this isn't working like it's supposed to. Because the second she stops with instead of like having a period of calm for where you like see that it obviously did something for her before she starts coughing again, because she has coughing asthma, not like the audible wheezing asthma. She just continues to cough like all day. And if she was wheezing as much as she's coughing, we had been at the hospital 3 weeks ago. You know what I'm saying? Like, so let's go down to the findings, because that's that's how these are usually set up, is the summary at the beginning and then the like bullet points. Okay, uncontrolled asthma associated with increased numbers of neutrophils in the airway. Parameters negatively correlate with lung function. Neutrophil recruitment is crucial for development of skin allergic inflammation. Pollen allergenic extracts and cat dander immediately recruit neutrophils to the airway in TLR4, MD2, and CXCR2 dependent manner. Repeated recruitment of activated neutrophils following exposure of pollen allergenic extracts or cat dander facilitates allergic sensitization and airway inflammation. Her pollen is like her kryptonite. Once, which is weird, because when we were in Georgia for the year, we were on the coast, right by the ocean. We were like 10 minutes drive from the beach, from the ocean. We had a relatively good year. She didn't have to use. I think she only had to use a nebulizer like twice. It's really weird because everyone was telling us how badly we were going to be affected by the weather, the pollen in Georgia. But we weren't. And I'm thinking that's because it's a stable climate. Since barometric pressure changes and weather changes and having 4 extreme seasonal changes, the one from winter to spring and summer is just, it's it's a Lulu. Okay. And it knocks her out. Like it just, and this one, we're around 4 weeks now of her just being absolutely miserable. All right, let's see. The molecular mechanism, repeated recruitment neutrophil shifts the airway inflammation to allergenic phenotype in active areas of research. Inhibition of CXCR, LTB4, MDD2, and TLR4 may serve as strategies to inhibit induction of allergenic sensitization and inflammation. Okay, so I need to, 1 minute. This right here, this sentence, I need to, doctor's gonna love me on this one. Let's open this up, and 1 second, file, new. I'm just putting this into a document. There we go. So now I can go back over here, and we can go back to what we're doing. Hello, V. Morris artist. I love following other artists. I'm an artist too. I've got an art account if you'd like to check it out. Painted Dead Studios. Sometimes I try to share over here on Chronically Spicy because I don't have I have a very small follow number over there because I don't post over there as much as I should. But working on it. I've been a little distracted lately. All right, 861 for allergy count, antibacterial creams. 862, antifungal creams. 863, sharing. Okay, so you want to hop on over to YouTube, you can see what I'm sharing. Because I'm screen sharing. So antifungal creams, antihistamine drugs. I'm gonna have to break that list down. Okay. So I'm gonna have to go. I'm gonna create the next category. Is going to be just antihistamines, right? Eye drops. That's why I can't do ketotifen, because in the United States, ketotifen is only available in eye drop form. So I can't do that one. Hydroxyzine is another medication that cannot be made without ethylene chloride. It's like structurally part of the medication, and it's also structurally part of the most almost all except one, as far as I know, antihistamines, and that's the diphenhydramine. 867 is Mycolog cream, old formula. Okay, so now we're looking for antihistamines. So let's go here. Share instead. Wait a minute, if I can see it. Yeah, because this list is not, let's close that. This. Okay, we're going to close that one second. Let me close some tabs so my MacBook doesn't get mad at me because I can't afford to get a new computer right now. All right, so this is the one that we will, let's go here, close that one, and here, okay, let's close this one, and then here, 1 second, oops, no, that's not what I wanted to do. Hi, okay. All right, let's do, that's not the one I want either. 1 second. No, I don't need that one. All right, let's look here. Different type of systemic corticosteroids. Did I already do this one? I believe I did. Okay, yes. So then now we can go to antihistamine list. Okay. Now I already know from previous research, Gen 1 antihistamines, except for diphenhydramine, unless that's been updated. Timune. Thank you for the likes. I appreciate it. So let's say anything Gen 2 on for antihistamines automatically is going to contain ethylenimine tetrachloride, and most likely is going to contain at least one coconut allergy derivative. So let's see. Long-lasting 10 best antihistamines, antihistamine medicine, antihistamines for allergy, Walmart. Not exactly. Here we go. List of common antihistamines, antihistamine RXs. Let's go to, here we go. Cleveland Clinic. I will trust that one. Antihistamines. Let's go to screen share because I need to screen share. And let's go back over here so that I can fix these. There we go. Now we're good. All right. So antihistamines are common over-the-counter prescription medications, help with allergy symptoms, can also manage other conditions like digestive issues and motion sickness. Because there are so many options to choose from, it's best to talk to your healthcare provider or pharmacist about the right one for you. Okay, again, this is because I'm stupid proofing my allergy list for my current and future doctors, because I don't have any H1s that I can take other than diphenhydramine. And that one I used to save as a rescue because taking it every day as a stabilizer puts me at risk for becoming sensitized to the medication, and I'm already on the highest dose that you can be put on. And because I don't have anything else to stabilize my mast cells, there's a chance that one time I could actually administer diphenhydramine and it just not work. I'm already if I've got the Benadryl out, I have to happy. So that's not exactly a good sign. Yeah, allergic to the poison in the cure. Woot. Okay, so most antihistamines are over-the-counter OTC medications, but they also come in prescription form. Antihistamines also are common ingredients in the following OTC medications, which is why I cannot take anything when I have a cold or the flu, or I'm congested, or I'm coughing, or some pain relievers too. Great. Okay, so it's the cold and flu products, decongestants, cough suppressant, pain relievers. All right. Let's see. We're going again, stupid proofing. So I'm putting it all like if it seems like I'm being too clear, I'm probably not being clear enough because I had antihistamines and ethylene hydrochloride on my list for the doctor who ordered the MRI, and he was like, "Yeah, patient is recommended to be prescribed prednisone or another corticosteroid prior to the MRI." And I was like, I messaged them, and I'm like, "Yeah, can't do that. I'm allergic to it because ethylene hydrochloride." And he was like, "How's that connected?" And I'm like, really? Okay. All right. So 868 is just going to be the cold and flu products subhead. 869, decongestants. 870. I'm trying to finish as much as I can tonight because tomorrow we are looking at for weather. There's warnings for and alerts for severe weather, hail, winds up to 70 miles an hour, or worse. That's the first round because we're supposed to get 2 or 3 rounds. And the evening rounds shows strong potential for tornadoes. So I'm trying to get this done as much as I can tonight because I need to make sure that I have my appointments at like 9:30 in the morning on Tuesday. I will not be sleeping tomorrow night. Not because hey, ye all-nighters, but because I have severe medical PTSD and major anxiety. So it doesn't matter what time my doctor's appointment is the next day, or for her, I'm always afraid that I'm not going to make it on time. So, yeah, I just stay up so I don't accidentally miss it. Okay. What types of antihistamines? Healthcare providers divide antihistamines into 2 major subtypes based on which histamine receptors they block: H1 receptors, H2 receptors. MCAS involves needing blocking for both. I can take famotidine. It does contain one coconut derivative in it, I believe. I'll double check later. But like I can tolerate it. And this, with as crazy as my allergies are, I'm at the point where we go with the least. If I'm allergic to it, can my body tolerate it? And I can tell you based on the first attempt if it's going to work or not. All right. H1 antihistamine receptors. I just need names, guys. I know what it can treat a bunch of conditions. First generation and second generation antihistamines. Okay, that's nice. Okay, here we go. A few examples of first generation H1 antihistamines include. Okay, so this is not going to be a complete list, but it'll be good enough because I'm going to put on here allergic to everything. 1 second. Let me go back over here. There we go. All right. Now let's go back over here. Share the screen instead. Okay. Wait a second. I saw anticipate, and no, I'm going to do it here because I am not renumbering this. Again, I'm live streaming on YouTube, and I am screen sharing so that you can see what I'm doing as I'm doing it. So if you'd like to check out and see and not just hear, the YouTube channel is Chronically Spicy. All antihistamines except, wait a second, allergic to all antihistamines except for IM diphenhydramine. I cannot take OTC Benadryl or generic diphenhydramine because the liquid contains glycerin and the capsules contain glycerin or glycerol, which is coconut derived or soy derived, but they don't tell you what the source is, so I just assume we're not going to do that. And the gel caps for the dye-free ones make me projectile vomit because high histamines, gelatin, and before I realized that the liquid inside the gel caps was, also contained coconut derivatives, I was literally taking a sterilized needle and poking a hole in it, squeezing it onto my tongue. And I didn't know that Benadryl, like on your tongue, wasn't supposed to feel like you were, squirting fire onto it. But I had, right. So yeah, that doesn't work. That doesn't work for me. Hello, Stephanie. How are you? Excuse me. Hello, Leo. I'm not going to say names. Hi. I've been trying to say so many different medication names today that my tongue is like purposely trying to like sabotage me sounding like I know how to speak. All right, ow. Okay. I have a heating pad on my thigh because the last time ow, that is swollen like I've got a welt on my thigh like this big right now. Can't do anything about it. Okay. All right. Because I know exactly why I have it. I don't react well to my medications that I'm taking when I don't have my mast cell stabilized. And I don't have my mast cell stabilized because my doctor's like, yeah, you don't need that much for mast cell stabilization. And I'm like, okay, here's the thing. The average person with MCAS, right? And I'm not minimizing, I'm just explaining. But like my daughter, right? If you have like MCAS, right? And you don't have all these extra stupid things happening, you're usually prescribed H1 and H2 blockers twice a day. So like Allegra, Claritin, Zyrtec, right? Say morning and night. And then most doctors are going to be like, and you can get it OTC or you can get it prescribed, right? Or compounded if you have to. Most doctors are going to tell their patients, and this was what I used to do. Okay, so the weather's changing, barometric pressure is dropping. You're gonna, your hormones in your cycle are making you more reactive right now. You're about to exercise. Pre-treat. So you got your morning and your night stabilizers with your H1 for antihistamines, your H2, your like acid blocker like Pepcid, famotidine, right? You can take it a third. You can do a third round if you okay it with your doctor, and that's fine. So like the average MCAS patient, it has their mast cells stabilized, both receptors, H1 and H2, 2 to 3 times a day. I don't. All right. So I just wrote antihistamines, parentheses, allergic to all antihistamines except for IM diphenhydramine. So a few examples of first generation H1 antihistamines include, okay, we were at 871 allergies, right? So this is 872. Brompheniramine, chewable tablets, Brovex CT, 873. Again, screen sharing on YouTube if you want to check it out. Chlorophenamine tablets like Ahist, Allerchlor, and chlortrimeton. That was 873. Okay. Now we're breaking this up. No, I was leaving it in the same one. All right. So that's 873. All right. 874 is clementine tablets like Dahist, Tavist allergy. This is 874. Okay. 875 is cyproheptadine oral liquid like periactin. Periactin. 876. I love TikTok. Like, this is like where all the night owls go. Like, I can try and live stream because I do this when I can. Usually it's in the evening, like when normal people are sleeping. But you know, we're all here. I usually have like the most like involvement and engagement. You're fucking kidding me. 1 minute. Okay. 877 is diphenhydramine, capsules or tablets. Okay. I don't do capsules. I don't do tablets. Like Alka-Seltzer Plus allergy, Benadryl, and Vicks ZQuil or nighttime sleep aids. Okay. Why am I afraid to look up intramuscular diphenhydramine, ethylenediamine hydrochloride? Doesn't matter. It's my only option. Okay. 878. Doxylamine tablets, Unisam. 879 is hydroxyzine capsules or tablets, Atarax, Razine, or Vistarol. My daughter's on hydroxyzine. Every time you go into a doctor, because they try to push hydroxyzine now because you know everyone's going all demonizing anti-anxiety medications that happen to fall into the controlled classifications because that's what they're being taught now in medical school. And when they're getting their degrees for whatever specialty or position they're going, nurse practitioners, pharmacists, etc. Like, oh, that's just bad. You know what? It was good for a long time. It helps a lot of people. Some people can't tolerate them. And I understand that. Some people don't want that kind. I understand that. Yes, there is a potential for addiction. I understand that. But hello, Robert. But when you have the conditions that I have, you don't have many other options if that's literally the only thing you can take. My daughter, and by the way, she takes hydroxyzine 2 to 3 times a day. Somebody suggested hydroxyzine to help her sleep, and I looked at the nurse. I think one of her nurses, and I was like, it's not going to do anything for her at all. She's been on it since she was 2. She's also ADHD and autistic, and all it does is help stabilize her mast cells and pollen allergies, right? Okay, so we're at 879 for that. Now let's go back to the list here. List of second generation non-drowsy for allergies. All right. Copy. This is where I got that from, right? This is from Cleveland Clinic. Okay. Okay. So now I go back over here. Share this screen instead. Okay. Again, I am live streaming on YouTube. So if you'd like to actually see what I'm doing with screen shares, feel free to hop on over there so that you can take a look. Yeah, I know 83% of my storage is used. I'll clean up space later. I don't have time for it now. All right, so list of second generation non-drowsy antihistamines for allergies. A few examples of non-drowsy H1 antihistamines include, okay, so 879. Okay, so as azolistine eye solution is 880. Azolistine yeah, I'm allergic to that too. My what's it called? We call it our bubbly machine, but the soda, the one where you can make your own homemade carbonated drinks. Yeah, that's basically. I'm gonna start using it for my daughter and my husband because I got it for Christmas a few years ago, but I can't drink anything out of it anymore, and I can only drink two kinds of. All I can drink for water is two brands of non-filtered, bottled at the source spring water. Fiji water and Poland water are the only two that I can drink. Okay. All right. 881. 882 is cetirizine tablets for Zyrtec. 883 is deslatoridine. I have Clarinex. Okay. 884 is fexofenadine. Allegra. 885 is loratadine capsules or tablets. Claritin. That's what I was taking forever. And granted, I wasn't having noticeable. I can tie a reaction directly to having taken that medication, but I also know that taking it was just inadvertently exacerbating the allergy in and of itself because it contains that. Hello, Marak Fitness. All right, so we're at 885. That's with antihistamines. Now, chemotherapy options. Let's do that one. And because this is for, 1 second. One second. I have to go back into this file, and I have to. Let me find it. Did I? Let's close more tabs. Here we go. I found. Okay, so that's a tab that I need. Leave that one open. One second. I'm just closing up a little bit extra here because we have a lot. I might be contacting Cleveland Clinic to see if they have recommendations for doctors in my immediate area for information on and treatment for the macroglobulinemia, mother of God, Waldenstrom macroglobulinemia. you'd think I'd have that straight after like researching nonstop for like 10 days now, but no, that's just all of the syllables and all of the alphabet in one word. So you're never going to sound, I'm pretty sure that word is made to make you sound not sober. Share the screen instead. Yeah. Those are some total categories I don't want to look up right now. Current and emerging treatments for Waldenstrom macroglobulinemia. All right. Sure, let's watch this guy. Okay, we are watching a video. If it will load. Hey, Talmaj. View the studio. View tab. Why is it not loading? Reload. Are you gonna? Is it gonna play or no? Maybe no. All right. So let's not do that one. NORD, the National Organization for Rare Diseases. That's a 6-minute video. I'll do a follow-up, and we'll and live react to that one on the YouTube channel very soon. It's relatively new, research wise, published, posted in 2022. So hope all is well, Talmaj. All right, so Waldenstrom macroglobulinemia is a form of lymphoplasmacytic lymphoma. And there are many new therapeutic agents available. Indolent B-cell neoplasm accounting for only 1 to 2% of all hematological malignancies. Okay, so let's look at chemo treatment options. Nope, I'm not clicking on Mayo Clinic right now because I'm mad at you guys. Because they didn't tell me when I left after being a patient there for the entire summer. Nobody said, hey, by the way, your levels, you got, like it's diagnosed in my labs. Nobody told me. I found it myself last Friday. So that was fun. All right, so ASH publications, BTK inhibitors, fixed duration chemotherapy. So let's look up chemotherapy options. All right. Things I never thought I'd be saying for 1,000, Alex. Exciting advances in wellness from macroglobulinemia treatment. Okay. Treatment paradigm in Waldenstrom macroglobulinemia. New I almost said strategies, like I just watched too much Bugs Bunny. Okay. All right, let's go to the American Cancer Society and look at, all right, options. Chemotherapy for Waldenstrom macroglobulin, WM. All right, we'll go here first, and then I can break up the rest. I think I'll finish after this category tonight, and tomorrow I will go through. Let's go back over here first real quick and see how many more do I have to go through. Oh my God. Did that one already. Did that one already. Closing tabs. And then I must have closed the one that I was looking at. The American Cancer Society. Treating. All right, let's go back over here and screen share so that you can watch on YouTube if you are wanting to see what I am sharing. Chemotherapy for Waldenström macroglobulinemia. There we go. All right, so now we get to look up all of these. Oh my God. All right. This is gonna be fun. We already know that chemo, has a whole lot of side effects, but it's a necessary evil for a lot of people who are battling various types of cancer. And I know people with systemic mastocytosis who have had or are on chemo for that. But I don't think I can take any of them. Okay, I'm going to print chemotherapy options. Information from American Cancer Society. And because I have to put source for finding. All right, so now this means I get to do my doctor's job now because they're not going to do this part of the job. Okay, and I don't get paid for this. Or I don't get an honorary doctorate for this. Okay, so now I get to look up cytozan. Let's just look up. Let's try that one. Cyclophosphamide. I used to be able to read. Okay. 1 second. So now I can look that up because this is what I have to do with everything. When a doctor says you need X, Y, or Z, I get to look it up on my own and cross-reference for every single ingredient. Okay. All right. Package insert for the medication. Should this tab instead? All right. We are specifically looking for ingredients. So we are skipping through, again, live streaming on YouTube. So screen sharing over there. Use in specific patients, indications, obviously myeloma, leukemia, neuroblastoma, adenocarcinoma of the ovaries, retinoblastomas, breast cancer, et cetera, right? And also in pediatric patients for various conditions. Administration, recommended for the malignant diseases, recommendation, blah, 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 dosage, form, and strength, contraindications. Anaphylactic reactions, including not surviving, have been reported with cyclophosphamide. Cross-sensitivity with other alkylating agents can occur. I can't take any alkylating. Ethylene dichloride automatically is, if it's an alkylating agent, it contains ethylene dichloride. Pulmonary toxicity, secondary. Why is it so hard to find? I need just the list, people, of ingredients. That's just what I need. all the different drug interactions. Increase and tamoxifen used in specific populations. That's lovely. I just need to know what's in it. Infertility, pediatric use, geriatric use, use in patients with renal impairment, overdosing. Thank you. Okay, here we go. Okay. So I'm screen sharing, right? Hello, Patrick. How are you? Cyclophosphamide, which is a chemotherapy option, often recommended. First one that was under the list of recommended treatments for macroglobulinemia, which is a chronic form of blood cancer that is slow progression, usually not diagnosed in people until they're 65, and usually not diagnosed because the doctor's looking for it, but trying to figure out what you got other health issues, and they're like, oh, wait a minute, then they find this. Yeah, good times. All right, so cyclophosphamide is soluble in water and alcohol. Each capsule for oral use contains 25 milligrams or 50 milligrams cyclophosphamide monohydrate USP, and the following inactive ingredients, and we're done. Pre-gelatinized starch, that is super high in histamine, and also starch is usually made from corn, so that's the potential for a latex allergy cross. I'm not allergic to corn yet, but and I might never become allergic to corn, but I have to be aware of the possibility because latex allergy is progressive for some people, and the people who are progressive tend to slowly, sometimes quickly, lose other foods. I've learned that if I am eating a food more often, I lose that food first, or that one goes. So like, well, I can still eat shellfish because I save that for special occasions. Lost avocados because I was living on those because I'm Mexican American and buy avocados. Anyway, by the way, fun fact, this is actually helpful for people at MCAS. From what I understand, if you're not allergic to latex or avocado, and it's just MCAS, not minimizing, just differentiating, you can use and look this up and verify with your doctor, not giving medical advice, sharing just, research from personal experience. Because this is what I was doing before I realized that I'd lost avocados. The reason that avocados are high in histamine, because they're also a high histamine food, so they're a potential MCAS trigger. But the reason that they're high in histamines is because the histamines are in all of the little hair, all the little black lines in the avocado, like the hairs in the inside the fruit, the meat of the fruit. That's the part that contains all the histamine. So if you're using avocado oil for cooking, it's no histamines because all of the hairs, right? All of the histamines are processed out when they're turning the actual meat of the fruit into oil for cooking. Anyway, back to this. My nose isn't working anymore. All right, following inactive ingredients. So pre-gelatinized starch. Automatic, no, I will projectile vomit. Even it doesn't matter what it is. That's done. And sodium stearyl fumarate. Anything that says sodium stearyl is coconut derived. And if that's the second thing listed, if the first one's going to trigger my MCAS and the second one's going to trigger an anaphylactic reaction, it's not going to work. Each gelatin capsule shell contains FDC blue. I'm allergic to dyes, ethylene hydrochloride. FDC red. I know that red dye has been banned from food medications, but pharmaceutical companies, I think, have 2 to 4 years to actually come up with an alternative. And the problem, this is going to be a huge problem for people with allergies. I'm going to have to do a separate video on this topic, because everything I've read on the whole red dye, like how manufacturers of food products, candies, medications, etc., that need red dye, are going to be very problematic, because according to one insider in the, I don't remember if it was a food insider or a pharmaceutical insider, but this person was quoted as saying that the problem is there isn't one singular replacement that's going to work for every option in every category. Like right now, you can look up red dye 40 and it's the same if it's used in your icing for your red velvet cupcakes, or if it's used in, the cough medication you're taking. Red dye 40 is red dye 40. They're going to have to find a variety of different things that are going to work for whatever formulation they're trying to make: liquid, solid, medication, food, candy, whatever. And I know that one of the things that can turn that might be used, or I would imagine would be, is probably already being trialed, is I forget the name of the beetle, but there's a beetle that is used, crushed up. It's used as a red dye. It's exoskeleton. That's latex cross. That's sharing proteins with shrimp, roaches, dust mites, latex. See what I'm saying? So people with food allergies and latex allergy are going to have to be very, very careful when it comes to anything with dyes, once the changes go into place. Whether or not you're already, if you're not allergic to dyes currently, that's something you have to be aware of, because it might not be the dye that you're allergic to. It might be the ingredients in the dye. So yeah. In addition to the ingredients above, each capsule contains black ink. Black ink contains black iron oxide. Isopropyl alcohol can contain, it's coconut. Butyl alcohol, coconut. Propylene glycol, coconut. Strong ammonia solution, dehydrated alcohol. Anything dehydrated is high in histamine. Alcohol is high in histamine. Potassium hydroxide, purified water. Purified water is going to be filtered. Anything filtered is going to contain trace elements of coconut, because the filtration systems use either or both carbon and charcoal filters, and in the filters, and those are both derived from coconut. And shellac is going to contain ethyl and diamantate chloride, and most likely coconut. Lovely. Okay. So we're just going to put this under. Why I can't take it. All right. So let's go back over to this list. Share instead. Alkylating agents all contain ethyl and diamine dihydrochloride. All right, so here I'm back to screen sharing the allergy list. So, oh, that did that work properly? Okay, here we go. Each capsule for oral use contains 20. Let's see. According to what's the source I'm using here? This is rugs.com with a D at the beginning. All right. All right. So Good thing I was the weird kid in class who was like, every time a teacher was like in high school and college was like, hey, yeah, you have a paper, a surprise assignment. I want a paper, I want a 10-page paper, a 30-page paper on insert topic here, in 3 days or a week or a month or whatever. And I was like, yes, research. All right. Okay, so we are on 885. Yeah, 885. Okay, so now chemotherapy options. Cyclophosphamide is 886. Working on top of 1,000. Allergens contained within are as follows. Okay, so this is what we're going to do here. Because we are not including all of that. Why am I rewriting it? just delete what I don't need. Work smarter, not harder. Sometimes I remember to do that. Pre-gelatinized starch and sodium stearyl fumarate, coconut. If any doctors are looking for a research assistant, hi, happy to cross-reference a patient, or if you're a patient with a ton of with allergies and you're dealing with trying to figure out, let me know, because this is why I became a journalist, because my driving reason for finding the why. That's what I need. Let's find the why. Hello, Leanne. Pre-gelatinized starch, MCAS trigger, and potential latex allergy, latex fruit syndrome, if I spelled it properly, syndrome trigger per allergy and asthma network. Sodium stearyl fumarate, coconut derived. Okay. Each gelatin capsule, gelatin itself, high histamine, MCAS trigger, causes projectile vomiting. So even if I wasn't allergic to anything in the capsule, I wouldn't be able to keep the capsule down anyway, and it wouldn't be pretty. Capsule shell contains FTC blue, FTC blah, blah, blah. Okay. All dyes contain ethyl N-diamine dihydrochloride per Contact Dermatitis University. First, if I can spell, I promise. I'm just ADHD. And DermNet. Is doing tonight, and info on ethyl and diamine. Who else's iPhone automatically knows how to fill in how to spell ethyl and diamine dichloride? Because mine learned, and titanium dioxide. I'm not sure about titanium dioxide, but I've already got enough here, right? In addition to the ingredients listed above, each black ink, black iron, black isopropyl alcohol. Okay, so let's go to the ones that I know for sure. Black ink. I'm just gonna write EDD here. Ethyl NA diamine dihydrochloride. Black iron oxide. EDD. I'm allergic to everything in this. The entire thing is just one giant, hey, you want to have a reaction? Because you can have a reaction. You want ants? This is how you get ants. Isopropyl alcohol. I'm going to be putting together a document after I finish this round of insanity. Probably a PDF that I will list for, it'll be free for Patreon supporters, and I'll probably list it on Gumroad as a purchasable download PDF. Your list of coconut allergens, all of them, sorry, shopping with you. Because I thought my grocery shopping for coffee creamer one time, literally 2-minute drive. 2 hours later, he's not home yet. And I'm like, are you okay? I called. And he's like, I'm just literally in the dairy aisle, like researching on my phone to find a coffee creamer that I can drink. And if I give you a kiss right after, I'm not making you explode, because most coffee creamers contain a lot of dairy products, including cottage cheese, ice cream, yogurts, dairy creamers, anything in a waxed sealed carton. Those are all going to contain polypropylene glycol and or mono and diglycerides, which are coconut derivatives. And it took him about 3 hours to find one on the shelf that did not contain something that was going to make me explode. And I was like, time we go shopping, it's like, can we buy this? I learned the hard way that yeah, right, that I was exploding because I was eating cottage cheese every day. I still do, but now I'm only eating one of 2 brands that I have found that don't contain mono and diglycerides. So if you're allergic to coconut and you're trying to figure out what the hell is setting you off because you're not eating any, look at your cottage cheese, look at your coffee creamer, or look at your ice cream. Haagen-Dazs is one of 2 brands I think I found that are safe. Daisy and Good Culture are the 2 brands I found coconut allergy safety that I can eat. The rest contain coconut. They all have mono and diglycerides. So, yeah. Hey, Emily, how are you? Hello, Shelly. Hello, Majestically. All right. So, and okay, 86. I'm not breaking down and adding that as 87, like all of the like allergens within the cyclophosphamide. I'm not like individually numbering those, but they're all listed, right? So, okay, black ink. So let's. Oh, that's what I need to do. All right. All right. Capsule shell contains. Okay. Okay. Black ink. Let's do that. Black iron oxide. Isopropyl alcohol. Butyl alcohol. Okay. Strong ammonia solution. I don't know, but I'm gonna just take. I'm taking it out. Dehydrated alcohol. We're gonna put MCAS trigger. You know what? No, I react to strong ammonia too, so we're just going to MCAS trigger. We're going to do that one. Strong ammonia solution. So see, this is the fun part. If it's not high histamine, it's going to contain coconut. If it doesn't contain coconut, it's going to contain ethylene chloride. If it doesn't contain ethylene chloride, it's going to contain a latex allergy cross. I'm pretty sure I was a horrible person in my past life. And karma's like, yeah. All right. Strong ammonia solution, MCAS trigger. Potassium hydroxide. I don't know, so we're just gonna take that one out. I'm not gonna tell the doctor, and I'll bring it up early, but I'm not listing purified water on here because I'm just not right now. But I will explain that I will only filtered water because I don't want them looking at me going, well, you can't do epi and you can't do Benadryl. I can if my mast cells are stable. I don't get welts every time I administer my medication. If you want, there's a beef sticks and cheese sticks in there that we bought, and Dad got beef and cheese sticks from one of the local farms up there.
I might get myself toast.
You can have toast. Have a little bit of protein with it too.
Okay.
Like one like beef stick or something. Okay. Shellac contains coconut and EDD, ethylene chloride. All right. Next medication is bendamustine or Creanda for chemo options.
How do I open this?
Bring it over to me. Actually, scissors. I need scissors. Yeah, I need scissors for that to open it for you. Copy. I was not sharing what I was. This is the page that I was on. Okay.
No.
Sorry. Thank you. Opening some beef sticks for the. Well, she's almost an adult. She's a few months shy of being 18. It's weird because now I look at her 6-pound Pomeranian and go and tell her sometimes you were that size when you were born, and now she's like an actual fully formed human, right? Like that's just trippy. Okay. All right. So that's the page I was on, right? And I would have to go all the way to the bottom to find the stuff that I needed. So sorry if you're watching on YouTube and I didn't swap that over fast enough. All right. Hello, majestically awkward. I absolutely love your username. I too am majestically awkward. So I need to use the charger. I'm at 8%. Sorry.
Fine.
No, I was apologizing to chat, making anybody who look away from the screen if you get motion sickness. Okay. All right, 1 second. We need to do this because the charging cable is not long enough to yes, and it sounds okay. All right. Hi, so we're going to do it this way so my phone can charge. Is it charging? Yes. Yeah, we're back up to 11%. We're moving up. Yay. Okay. Now we are going to be looking at infusion. 1 second. Bendamustine. No, I'm not using Mayo Clinic as a source right now because I'm mad at you. Cancer.gov drugs, bendamustine hydrochloride. Let's see. It's used for B cell, approved to treat B cell non-Hodgkin's lymphoma, which is the category that macroglobulinemia falls under. Okay. And other types of cancer. Clinical trial accepting patients. Yeah, no, I can't do that. And that's not even the information. Like, this doesn't show anything that I need. FDA label information for this prescription is available at Daily Med. Okay, so let's go there. Okay. Are you going to open for me? Okay, thanks. Injection powder, solution. This is a lot of, I just need ingredients. Do I need to literally look up every single option? No, we're not going there. All right, let's just go up here again and see if I can just find bendamustine ingredients. Dosing and administration. I'm gonna have to Benadryl soon. Package insert. Oh my god. All right, here we go. Let's try this one. Share this one instead. Again, we are on rugs.com. Starts with a D. Bendamustine injection packaging insert. Indications, usage, dosage, administration, form and strengths, contraindications, warning and precautions, interactions, overdose description, clinical pharmacology. Is that the one that's going to contain description? Okay, we're already done. That was fast. So if you're watching on YouTube, you will see why I automatically started because I'm not looking further than this. I have a rule when it comes to medications, and for example, I had to go to the ER last year in Georgia because I got bitten by a brown recluse spider. I didn't see it happen, but I have a friend who is a 3-degreed nurse who was in her medical glory when I was just sending her these nasty pictures of this wound that I couldn't figure out where it came from and this massive swelling that I was getting. And then like the wound started to necrotize and it got all gross and everything, it was bigger. It was like 2 hands long because I get massive swelling from house spiders. So like a brown recluse, I must have sat down when I was walking my dogs late at night, like I must have like literally like pissed off a spider because I almost sat on it and it was like, and it let me know. I didn't feel it. I didn't see it. I guess that's how most of those bites happen. And let's just say it's a good thing I didn't see it because I probably would have literally had a heart attack. Anyway, a week later, it's way worse. And she's like, you need to go to the ER. Okay, fine. So I go to the ER. I had to go through every single medication, antibiotic that the doctor was sending the nurse in for a prescription because he heard me say coconut allergy. And he turns out after I sent back the 6th, I think, prescription, he comes storming in the room like I've like offended his ancestors. And he's like, what's wrong with this one? And I'm like, it contains polypropylene glycol. And he's like, it doesn't say coconut oil in the ingredients. Really now? I understand that. I'm like, there are like 300 to 400 different, there are hundreds of individual FDA allowed, approved, different names for which different manufacturers for companies can use instead of saying coconut. And they don't have to say derived from coconut or made with coconut. They don't have to say it unless it says coconut oil. Like some products will be like, if it says coconut oil, it will be listed in the like, made with wheat, gluten, peanut, may contain tree nuts, whatever. But it's not one of the major allergens, so it doesn't have to be listed on products as a warning. And the most frustrating part for that is that for the people who are allergic to coconut, this is a disabling, life-altering allergy, because we have to be so fucking careful because of the number of things that contain it: shampoo, conditioners, toothpaste, mouthwash, um, lotion, sunscreen, medications that we might actually have to take but can't. Um, I can't use any hair care products at all. All I can use for my hair, and I've got afro hair. All I can do is olive oil in a squirt bottle, in a water bottle, spray bottle, mixed with water. That's it. I can't use anything else. And I have to buy a very expensive small business, small family made, true Castilian based true Castile soap, made with just saponified olive oil, sea salt, and water, because Castile soap used to be made traditionally with olives until manufacturers realized, hey, look, it's way cheaper just to reduce, swapping those three ingredients for all of the different forms of coconut, like Dr. Bronner's, for example, because everybody was like, you can use Dr. Bronner's. That's safe for baby. No, that entire list is coconut, like multiple different forms of coconut. It's like coconut came with all of its Mexican cousins, okay, for family dinner on Sunday, and then stayed for the quinceanera, like on, it's nuts, it's crazy, and then anything that says plant based, earth friendly, earth friendly, plant based, all of those buzzy, safe for the planet, all hypoallergenic. No, does not automatically mean that it's safe for coconut allergy. It means we're trying to convince you to buy our product because that's a job of marketing. And we're trying to do so in such a way that you can't sue us, because we didn't actually say, right? But right? All right. So, contraindications. Okay. Bendamustine hydrochloride. This is a second chemo option. Is contraindicated in patients with a history of a hypersensitivity reaction to bendamustine, polyethylene glycol 400. Any polyethylene glycol, it doesn't matter what the number is, because there's many numbers. All of those are coconut derived. Alcohol is going to be high in histamine. Thioglycerol. If it says mono at the front for the prefix, and it's got glycerol in there, or glycerin, that's usually coconut derived. Surprise, reactions to bendamustine hydrochloride have included anaphylaxis and anaphylactoid reactions. Anaphylactoid reactions, for those who don't know, are what MCAS patients without true confirmed or confirmable allergic reactions to certain things. Like, for example, I'm not allergic to coffee, but it's an anaphylaxis because it's super high in histamines. Even the kinds that are supposed to be low in histamines, I still react to it. So, but you can't. It's not. A test isn't going to show it, right? So that's an anaphylactoid reaction, where your body is going to react as if it's an anaphylactic reaction, because it technically is, and it needs to be treated as an anaphylactic reaction. It's just not confirmable or on testing. So that's an anaphylactoid reaction. You need to treat it. That's why MCAS patients are recommended by many sources, reputable medical sources, to carry epinephrine on them at all times, because you don't know what can trigger a reaction and how bad that reaction is going to be. All right. Contains Let's just do this 1 second. Then the moussine. I told you this was going to be fun. This is great. Okay. So Benamustine is number 85, 86. Let's say 86. 87. Okay, Benamustine. Allergens. Can I get paid for being a professional patient who's actually educated? I'm not talking down to anybody who isn't, because most people, this isn't. Okay, so research is a special interest of mine. I'm autistic. I need to, I've always loved the why, finding out the why. That's why I was so drawn to journalism. But the shit I'm looking up now is not because like, hey, good times. Although, again, finding out the why there's always that source of sense of just the world is coming in. Like the insanity is like clearing because I'm finding order within that insanity by answering the questions and this is shit that I'm doing this now because when I sit down in front of whichever doctor, whether it be the internal medicine doctor I'm seeing, or if I end up with an oncologist or a hematologist or whoever I'm supposed to see or referred to, I'm already going to have this list done. Note, I was diagnosed at the Mayo Clinic in 2024, in August of 2024. I found this list. I found this by myself. Nobody told me. They didn't tell me that I had a macroglobulinemia. Waldenstrom macroglobulinemia. I'm just gonna like print the document and point to the word when I'm in the doctor's office. See that one? Yeah, that. Okay. And I like words with lots of syllables that like roll off the tongue. That one doesn't roll off the tongue. It's like you trip over it with like you trip over it. All right. So allergen triggers in ingredients include polyethylene glycol, 400. And again, if the doctor is like, okay, so we need a challenge for any to make, how do you know we can challenge for that? No, we can't. I was diagnosed with coconut allergy the same day I was diagnosed with my ethylene hydrochloride allergy when Eliana, my daughter, who is going to be 18 in June, when she was 10 months old. And a doctor at Boston University told me like 10 years later, no, like 8 years later, was like, anything you've ever used in your house that made of plastic, that isn't made of glass or stainless steel, that has had something that contains coconut in it, is gonna still have coconut remnants in it, and you're going to react to it potentially because coconut seeps into porous materials, which is why I can't get a coffee or anything blended at all, even coffee free, at like Starbucks, because their baristas are trained. You say coconut allergy, they say, and you can only buy something, a drink that is made in the exact cup that we hand you. So an iced drink. That's it. You can't have anything else. Because they use coconut milk, they use almond milk, they use oat milk, they use soy milk, and there isn't a dedicated blender for each one. And they use dairy milk, right? And there isn't a dedicated blender that is never going to have coconut in it. And the cleansing solution that they use. Ethylene dimethyl chloride and coconut anyway. So yeah, but they Starbucks is 100% on, like, we are not getting sued for giving you a coconut allergic reaction. But it's your job, if you have coconut allergy, to tell the baristas when you go to the counter, if you have a food allergy, you need to tell them, I'm allergic to, what can I have? And usually it's like one of, like, the iced drinks I can have, and that's about it. All right. So polyethylene glycol, coconut derived alcohol. 1 second. And cast sugar. God, I hope the allergist I'm seeing on Tuesday actually knows mast cell activation syndrome, because I will know within the first 5 minutes if that's going to go bad or not. And at that point, I'll know what I can say or not, or what I can say or what. Just not in smile and wave, boys. Smile and wave. Because that's just where I'm at with doctors. Because yeah, I'm just wonderfully I'm medically complex. Okay. All right. Damn. We have purine analogs. There's fludarabine, cladribine, corticosteroids. I'm just gonna say entire class of. I'll share instead. Okay, entire class of this rug with a D contains ethylenediamine, dihydrochloride. I had somebody comment on one of my YouTube videos a couple days ago, and I have to go in and reply to them because I saw it in my notification. It started with, "Are you a doctor? I wanted to ask blah 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 blah." And I was like, honestly, if somebody had given me a crystal ball and said, "This is your future," I would have, in a heartbeat, like, switched to something medical. I know I can look at medical research, but medical researcher, but I don't know if you have to do, like, I have to look at and see what that actually, like, entails, because if that entails, like, actual, like, clinic hours, I can't do it because there's too much latex still being used in healthcare, which is why healthcare workers are one of the highest risk groups for developing latex allergy. So yeah. Okay, so corticosteroids, that's 87. 88 is purine analogs. No, that's just the title. So fludarabine, Fludara, that's 887. And the cladribine is 888. I have to look those up. Just gonna take a wild guess and say I'm allergic to those two. If I'm not, I'm fall over. 889 is corticosteroids. An entire class of this drug contains ethylene chloride and colchicine is made from crocus flower, which is a natural rubber latex family member, natural rubber tree. This is what colchicine is, the corticosteroid that I should be on for my Behçet's disease, but I can't because it's derived from crocus flower. And I told when the resident who was diagnosing and examining me for Behçet's, she was like, exact words were, well, this is usually diagnosed with clinical observation and photos. There isn't a test that can say definitively one way or the other if you have it. But I'm going to send you in for labs. And if you have positive for this specific, it's the leukotriene levels, I guess, then yeah, you have Behçet's disease. And my daughter was with me, and I saw her go, and I'm like, and we basically had a silent eye conversation with really, and yeah, and we'll talk about this shit on the way. We'll just smile and wave for now, nod your head like a good girl, keep your mouth shut, and we will. Are you kidding me? As soon as we get to the car, right? And I said, she was like, so if you are diagnosed with that, and then she had her attending come in when I was like, allergy, I'm allergic, I'm going to be allergic to anything prescribed for that. And she was getting frustrated. So I wasn't being combative. I was just like standing up for myself, and I'm like, I'm going to be allergic to medications for that. And she was like, I'll get my attending. So he comes in and like, pat, good girl. There, my dear. My pet, right? He was very patronizing. I wanted, let's just say, me sitting on the patient examination table and potentially moving my foot in a very fast upward motion would have definitely made contact with a certain area. And I wouldn't actually ever do that, but he was so patronizing, I would never, ever do that. But he was so patronizing that I will say the thought gave some form of satisfaction, because that's all I could do. I couldn't say anything because I was like, I'm going to be allergic to that. And he was like, how we'll get to that bridge, that bridge when it's time to cross it. And I was like, no, if that's the medication you're saying you're going to prescribe, if I am diagnosed with this, I looked it up on my iPhone while the resident was talking to me. And I'm like, that's a latex allergy trigger. It's made from crocus flowers. They're related to the natural rubber tree. And he just rolled his eyes like, how dare you be educated? Trust me, I'd rather not know. Seriously. All right, let me see. So, all right, so bendamustine. We're not looking any further on bendamustine because guess what? This right here is all we need. If it's in the top, if it says magnesium stearate, which is also coconut derivative, a coconut derived ingredient, that's usually at the end. Like, there are 2 medications that I'm taking that contain magnesium stearate, and they're at the end of the inactive ingredients, like either the second 2 or the last ingredient, right? I can tolerate those without having reactions to them, at least for now. Okay. And that's what I pay attention to. I can do that. But when the doctor came in for the brown recluse spider bite and was like, they don't say coconut on them, you need an antibiotic. I'm like, yeah, I need to find the one that has the least amount of coconut in it. I'm like, I can't, magnesium stearate's the only one I know I don't react to. Everything else is going to set me off. If it's 8 out of 10 ingredients that are coconut derived, I'm just asking for anaphylaxis and anaphylactic shock. I don't. So if you want me to take that, give me my first dose here and like make sure I'm already in the ER, in the emergency room, because I'm going to go under the anaphylactic shock straight up. And he was like, and after he walked out, he's like, I'll keep looking. Sorry if I'm difficult. The nurse came up to me and she was like, it's all right, baby girl. She's like, I'll come in with the prescriptions as he's looking through the options for you, and you do your research and you do your thing, and you talk to your nurse friend, because she knew I was texting with my friend, who has latex allergy too. Doesn't have coconut allergy, but she's very well educated, and we finally found 2 antibiotics that I could tolerate, or should be, and I needed both of them. So, because that's how bad the spider bite was. But that's what I'm trying to make sure when I walk into whichever office, whichever doctor is going to be the one I see for the macroglobulinemia, I can hopefully save us, I hope, drama and time by saying, okay, I've already done all this research for you. Code, I've already done all this research for me, because at this point I feel like the baby who was put in the washer with the onesie that ended up being the reason that companies were then had to add on the label that go on baby onesies, remove baby from onesie before putting onesie in washer. Because anytime a new warning comes out and is required on a product, it's usually because somebody did the thing that required the product to now contain that warning, so other people don't do the same thing. Okay, so we already know we can't do bendamustine. Okay, so crossing that out, or not crossing that out, but now closing that. Give me 1 second. We are now going to find, I will screen share back in 1 second. All right, here we go. Now we're looking at fludabarine, right? Okay, so let's go over here and screen share. All right, fludabarine. I can't breathe out of my nose. It's probably because the barometric pressure is changing. Not even kidding. Like, I'm not over that's a thing. Okay, for mast cell activation. All right, fludabarine. Wait a minute. Nope, we need to put ingredients. And here's another thing that I learned today. Sometimes it's not, even if you're looking at, what was I going to have? Oh, I stuck one noodle in my mouth to test, make sure it wasn't like, it was cooked, make sure it's cooked properly. A gluten-free, we did gluten-free. So I found a gluten-free corn-based noodle for my daughter because she wanted plain pasta with butter and salt. And I didn't look at the list of the ingredient list, other than I should have. It only contained 2 things. And guess what the second ingredient was? Monodiglycerides. Yeah. So I've got this noodle on my tongue that I instantly like spit into the sink and immediately Benadryl and grab my epi, and I'm like, yeah, right. So basically, yeah, she can have that. My husband was like, "Do you want to return it?" And I'm like, "No, she can have it. It just has to be served in glass bowls." and we can't store any leftovers in any of our plastic containers, or else won't be able to use that container again. So like when she has leftovers from yesterday, so they're stored into individual Ziploc bags, so that I can put it into a glass bowl to reheat for her tomorrow. And I'm like, I did it. I cooked them in a stainless steel pot, so we're good. So but that's right. Like you got to look at everything. And there's another thing I was looking at that we've got in our fridge. Oh, it's ice cream. It's because I have a homemade creamy thing. Hi, hey Vix. I have a creamy thing, creamy maker, the Ninja. My husband bought for me, so I make my own high protein ingredient ice cream and sorbets and stuff with what I can have. Right, Haagen-Dazs probably has the cleanest food ingredient list on foods. It's like water, cream, sugar, blah 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 blah. Not water, cream, sugar, vanilla extract, whatever. Right. But here's the thing: we have another ice cream in there that's vanilla. I forget what brand it is, but it says cream in it. And then I remembered, how long was my husband at the grocery store looking for a safe creamer, heavy whipping cream? I'm alert. There's 2 brands of heavy whipping cream that I can buy that don't contain monoundiglycerides or propylene glycol. So if I want to eat something that says cream in it, unless I know if that cream contains monoundiglycerides or propylene glycol or both, I can't eat that thing unless I want to take a chance and have the EpiPen ready to go. Oh, God. Yeah, I know. Oh, it's after midnight.
Yes, I already took them.
Okay, making sure.
I told you that.
I missed that. Okay. All right. So we're looking at Fludara. That's the next option. Yes. Rugs.com again with the D at the front. And we are going to... I'm screen sharing, share this tab, screen sharing for YouTube. Fludarabine should be administered under the supervision of a qualified physician experienced in the use of antineoplastic therapy. Fludarabine can severely suppress bone marrow function when used at high doses in dose ranging studies in patients. Fludarabine was associated with severe neurological effects, including blindness, coma, and not surviving the administration of the medication. That sounds like a great time. This severe central nervous system toxicity. I have CNS sleep apnea. my CNS system is already not happy. So CNS toxicity occurred in 36% of patients treated with doses approximately 4 times greater than the recommended dose. Huh? Okay. Similar severe, and my finger's swelling. My base shots is acting up. And mast cells. Good time. 1 second. Because skin is getting hard. That's my first sign. It's callousing. You see that? Yeah. It's callousing and getting hard and ow. 1 second. We don't play anymore. And 1 second. Ow. Everything hurts. Ow. Do you want to know what? If I have the medication I'm supposed to take, I wouldn't need to administer epinephrine right now. And I wouldn't need to administer intramuscular diphenhydramine either, unless I waited too long, because this is my first sign, my first domino. When this is going on, if I medicate fast enough with the medication I'm supposed to be on, more than I'm currently prescribed, because my doctor's like, I don't think you need that much. Mayo Clinic, although I'm not happy about what's going on with this whole situation, the EDS clinic doctor, who had nothing to do with that, was like, yeah, everybody they don't treat for mast cell, but they know mast cell, right? So since I was in there for the EDS clinic, like they were obviously very aware of comorbidities for EDS and MCAS being one of them, and like not every single health professional that I saw in the EDS clinic, when they were like, what can you take for, what do you want? What can you take? What can you handle? Especially because I was having multiple reactions in front of people, medical doctors, nurses, receptionists. They added to my file that I needed to be on that medication 3 times, 3 times a day. Awesome. That's what they put. And my doctor, my current doctor, is like, yeah, I don't think it needs to be that high. Okay. I'm not sure at this point, because I showed him my mail records and that wasn't enough. I'm not quite sure if printing out the NCBI, JAMA, and other research verifying that the medication, and I can talk about this more freely on my Patreon, because sensitive topics. But 1 minute. All right. I think I'm good. All right. Okay. Mostly, sort of, maybe. All right. So anyway, all right. So fludarabine, it's all kinds of bad. Can also cause fatal autoimmune hemolytic anemia after 1 or more cycles of treatment. That's great. It's like, here, I have some dynamite. It might go off. We're not sure, but it would stop the cancer. Okay, anyway, let's look at the ingredients, because I'm sure that's going to be just as much fun. I'm screen sharing on YouTube if you want to look over there. Okay. Focal seizures? Yeah. Wait, now? No. I was, because I don't have, my epi hits different when I am not stable with mast cells. Okay. And in administering my diphenhydramine, literally results in, like, can result in up to 10 minutes and like multiple paper towels worth of like having to soak up, the red stuff that seeps out. It literally squirts out. It looked like a little Merber scene a couple weeks ago, a week ago. and I only have one pill left that I broke into two pieces, half a pill left that I broke into two pieces. Um, so like, here's a tiny bit of the medication that stabilizes mast cells. I was making, and my leg swells and gets like major divots in the administration where I put the medication. Hey, Mimi and Ali, where I administer with the syringe, and it burns because that triggers my Behçet's disease. Right, means that my blood vessels are being attacked by my own body. Right. So, and there's mast cell involvement with that. So when my mast cells are active, which means when they're pissed because they're not stable, administering the medication that stops allergic reactions causes me to like have to pause for a minute and make sure that everything's good. Epinephrine can sometimes even and they're both made with sterilized water. So again, like I just what I'm supposed to be on that helps to control everything allows me to be able to tolerate those two things. It's kind of crazy. And it's one of those, I can't explain that to the doctor because I already sound like I know too many medical terms. I went to the ER 3 weeks ago because my thigh, instead of like just being rounded, right? Because I've got an hourglass figure, my thigh is like this. I've got like welt, divot, welt. It looks like I look like a ski slope on my thigh because of having to ration my medication to the point where my body's like, well, we can sort of tolerate this stuff now, and I ended up with open wounds and the swelling that was like insane. And my nurse friend, right, with the allergies was yeah, exactly, Joel. Siege. I'm glad. This is why I love it. I hate that you understand, but I'm glad that you understand, right? So mast cell, and I tried explaining this to the doctor in a patient portal note, and saying like, look, I have Behçet's disease, which is an autoimmune condition, blah 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 blah. Body attacks blood vessels activated or triggered by mast cell activation. Under control when I am stable with mast cells, and I am only stable with mast cells historically with the only medication that I can take that I don't react to, which is insert medication I can't say online here, because it's not commonly prescribed for that and not FDA approved for that, but mast cell aware doctors, including the Mayo Clinic, are like, oh yeah, that makes total sense. But the doctor that I'm seeing right now is definitely not mast cell aware. And I'm not quite sure if me printing anything out and taking, peer-reviewed papers to him is going to help or just make me look worse. So like at this point, I'm just nodding and smiling and basically quietly trying to research the other doctors in the same office as him, because there's a nurse practitioner and there's I think 2 other doctors that I could possibly see, and see if I can maybe just switch physicians. And I'm going to call the patient advocacy office tomorrow. You got to see my video, Joel, on my latex and coconut allergy reaction during my MRI, because they did all the wrong things and they had a full fucking week to get ready for me to show up. And the scrub caps they give you at the hospital are made of coconut fibers. Like every which way the whole time I was on that machine, my body was like allergic reaction, like jerking, like dystonia, allergic trigger dystonia, basically, because I had multiple forms of latex and coconut that were like in constant contact with me, and because I moved so much and I was trying so hard to stay still. Imagine trying to keep like restless leg syndrome, but worse. Imagine trying to fight the movement, the need to move, how much it hurts. I tried so hard, but because I moved so much, they weren't able to determine anything. And I've mentioned this reaction to my doctor twice and explained that that's why I was hoping for a an additional refill for the medication, because I had to medicate more than once for the reaction that was caused by the MRI staff, to keep from having to go to the hospital, right? And stay, right? Because I already didn't trust anything with what they were doing. And I'm like, this happened because of the reaction with the MRI, with latex and allergy exposure. I haven't even gotten an acknowledgement, and I definitely haven't gotten an apology. He and in his responses to me, nothing. He hasn't even acknowledged that that happened. So I'll be talking to patient advocacy tomorrow. I have an appointment with him tomorrow, a video appointment with him tomorrow, to discuss the microglobulinemia, but I'm not, and potential referral, whatever. I might go on the patient portal and reschedule it for Wednesday or Thursday, because I don't know if we're even going to have internet at that time, because the appointment's scheduled for around the time that we're supposed to get some really severe weather here in Wisconsin, potentially tornadoes. So, hey, Emily, Joel, thanks for the like. I appreciate it, bud. Okay, let's see. So let's see. We're looking anyway. I'm good now. But I'm going to tell you this. I am not happy about the fact that I have to administer both Benadryl and epinephrine when this happens, because the other medication that I don't have access to right now, in the amount that my body actually needs for both stability and rescue, would have this under control within 15 minutes, and it wouldn't even happen. I wouldn't be experiencing insane, like, are you like, what's the word? Hemophilia, but like exceeding, like severe kinds, like 10 minutes to stop the blood flow on administration of an intramuscular medication. That's not normal. Yeah, that one. I don't have the Mercedes. It was supposed. It's been 3 a day for the last 3 years. And I take 2, right? And then I save 1 for after midnight. So when I have this start after midnight, I can avoid having to go to the ER, because the ER is not set up for MCAS reactions. Like, I can walk in and say I'm having an anaphylactic reaction, and say my skin is hardening, So that's one body system, and I have constant freaking urge to need to pee, and impending doom, and um, insert any other low level anaphylactic combination of symptoms, and they're just going to look at me and go, but you can breathe and you walk and you drove yourself here, so why do you even bother coming in? Because the doctor in his last message to me, instead of apologizing for I'm so sorry that happened, whatever, was just like, if patient believes her acute reactions are that bad, essentially is what he said, she needs to come into the ER. And I'm like, that right there tells you exactly how mast cell aware he is, because mast cell aware doctors have told me, I don't go to the ER unless my second epi doesn't work, or I'm afraid I'm about to, no longer exist on this mortal plane. So if I use a second epi and I'm waiting for using the third, actually, I had a nurse tell me at an office before this guy that I could probably wait and only go to the ER if the third epi didn't work, because I told her I've been to the ER twice at that point after moving to Wisconsin, after administering 2 epis and needing to, it didn't stop the reaction. It was still progressing. And this is for MCAS. And they didn't do anything. They observed, they kept me, they observed me for like 4 hours, waited for my blood pressure to normalize, and waited for the swelling to stop. And then they were like, okay, cool, you can go home. Here's a prescription for more epinephrine. And I'm like, okay, thanks, bye. But each of those visits was $250 out of pocket. And I'm like, I can just administer the third at home. Okay. If the third one doesn't work, I know I'm in trouble. And that's the point that I get into the car passenger seat, or my daughter or husband, call an ambulance, and we go, because I know within 5 minutes if the pen has worked, right? Or is working. But this guy was like, no, you go to the ER. And I'm like, they're going to ask me why I came in, because I rarely have compromised airway issues. And most ERs believe and only understand that freaking skin is still hardening. My Behçet's is on skin coloration changing, swelling, and the callousing. Like, my MCAS is on, and I have to save what I've got in case tomorrow's worse, because tornadoes, weather changes, barometric pressure changes. Woohoo! All right, fludarabine. We already know this sucks, right? Indications, contraindications. Fludarabine, a phosphate injection, is contraindicated in patients who are hypersensitive to this medication or its components. Why don't you tell me what they are? It should be the first. It should be the first bullet point. I don't want to be digging for, I'm speed reading through, and I am still looking for ingredient list. Pregnancy, category D, precautions. Okay. General. This is ridiculous. Laboratory testing, interactions, carcinogenesis, mutagenesis, impairment of fertility, nursing mothers, pediatric use, adverse reactions, effects. You know what? This is so, I'm going to use a journalistic term here. Almost every single medical source, when you're looking for ingredients, berries the fucking lead. This needs to be the first thing. Okay. The most common adverse reaction. I don't care what the metabolic, nervous system, pulmonary system, gastrointestinal, cardiovascular, skin. This is still happening. Okay. It's got a scale. Adverse events. Body as a whole, 72 SWOG. I don't know what that means. N equals 32, 60. I don't even know what any of that means. But it's got everything from hearing loss to sleep disorder to cerebellar syndrome to sinusitis to GI bleeding, esophagitis. Oh my God. Okay. Overdosage, administration. Are you fucking kidding me? These need to be rewritten, all of them. Drugs.com, if you happen to see this, I will happily rewrite these for you. You pay me money and I'll make this not suck, okay? Because I can guarantee you that there are a number of patients who are not surviving the administration of this medication because they're allergic to something in it. And if they have to read through, like, I don't know, the entire Bible before you explain before you like start. This is like this is a bad no, this is actually a perfect analogy. You know those all the recipe like bloggers who like my favorites and the only sites that I favorite and return to are the recipe bloggers and YouTube creators who start with name of ingredient, time to cook, and then click here to skip to ingredients. Cool, thank you. Or they include it at the top, right? And then if you want, you can go through and read the like novel that they put in between on, that one time at grandma's house and the memories of the, spending time in the kitchen with grandma making blah 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 her special recipe molasses cookies. That usually it takes this long to read through all of that with their like affiliate links and whatever for all the things you can buy because you need to use this kind of whatever, right? Cool. I'm not mad about anybody trying to like, make money off of their writing and recipe creation and everything. I know that's hard work, but you know what? I'm there because I'm standing in the kitchen with an open refrigerator and I need to start cooking this shit yesterday because ADHD and I don't have that kind of attention span. I can sit down and read it when I want to. I'm not going to read it because I have to. And if it takes me this long to find an ingredient list on your recipe, I'm not going back. I don't care how good it looked in the picture. I ain't going back. Unfortunately, when it comes to this stuff, I have to find it. Well, that's comforting. The container closure is not made with natural latex. That's awesome. Thanks. You're kidding. Ingredient, inactive ingredient. Okay, active ingredient. Fludarabine phosphate. That's what it's called. So thanks. Inactive ingredients, mannitol and sodium hydroxide. Is that literally all it contains? Drugs.com, this sucks. This is like the rest of everything could be here that you have here, but you need to start with the ingredients list because I can guarantee I am 100% sure that the number of patients who expire due to adverse reactions, this medication would be cut down drastically if they knew they were allergic and their doctors knew to look and, well, you did this in the shorthand that everybody needs their information in, because nobody has this kind of attention span. This is why the average article for journalism is like 700 words or less, and you start with the inverted pyramid. Most important information at the top, least information at the bottom. And this is why our publications like the Daily Mail do like the 9-point bullet list of like the major points they're making in this in an article, like you're putting together like an essay for your AP English teacher in high school, because people don't have the attention span to usually even read past the fucking headline. And that's for the average American. That is not just because of this. Like the average American is like, I just need the 15-second short on YouTube. Thanks. Fludarabine ingredients. I need the ingredients. Find one that doesn't suck, because that information was shit. Okay. Let's try FDA.gov. Do you suck? I mean, okay. Okay. I think I can move this back now. Sorry. Okay. Okay. This one alone is wasting so much time. Yeah. If the first warning in the first paragraph's like, this medication is associated with severe neurological effects, including blindness, coma, and a funeral. The severe central nervous system toxicity occurred in 36% of patients. All right. Coma, seizures, confusion. Reported in patients treated at doses in the range of the doses recommended for chronic lymphocytic leukemia. So in the recommended dosage range, you're already looking at just the possibility of seizures and coma. And awesome. All right. Let's see if we can figure out why. Looking. Is this really it? Here we go. Fludarabine for injection contains fludarabine phosphates. What the fuck is fludarabine phosphate? What? A fluorinated nucleotide. I don't think I can do fluoride. A fluorinated nucleotide analog of the antiviral agent vidarabine. Now I have to look at vidarabine. Fludarabine phosphate, mannitol, sodium hydroxide. The chemical name fludarabine phosphate is 9H-purine-6-aminate-2-fluoro-9 -5-0 BD arabinofluorencil close parentheses, open parentheses, 2-fluoro-era AMP. That's awesome. Great. So it's Mexican because it uses all the names. The molecular formula of fludarabine phosphate and the structure is clinical pharmacology. Population. Okay, so what if you're telling me? I don't like that it's telling me that fludarabine contains fludarabine. That's nice. What is it? This is nuts. Is that really boxed warning? This is crazy. Lord Jesus, how are you? How you doing? I absolutely love your name. I love seeing you in the chat. Okay, I'm doing great. I'm losing my fucking mind because this one medication that for chemo is it's like reading through you know all of the affiliate link backstory novels that recipe bloggers and creators use before they finally give you the actual ingredient list. So you can make or purchase, if you're standing in the dairy section of the grocery store, and get out of the store in under 3 hours. I just need the ingredients. I think I found it, but I want to make sure because it's a very small ingredient list. And one of the ingredients is the name of the fucking medication. I appreciate it, Lord Jesus. Thank you. I showed my daughter your profile picture with the she was like, that's acceptable. I'm like, yeah, it's kind of perfect. Okay. Thank you for the likes. I appreciate it very much because I'm losing my mind right now. I just wanted to finish this classification tonight before my husband wakes up. I don't know if that's going to happen. Nursing mothers pediatric use. This is FDA.gov, right? Basic out of all the ones I've looked at so far, this one's like I'm sorry. This is are you sure this is a good idea? Oh my god. This is just all kinds of like bad. And if then all right, what let's look back up here. Sorry, if you're watching on YouTube, I know that fast scrolling when you're not the one like in charge of how fast you're scrolling drives me nuts. Like if somebody else is doing it, because like I have to close my eyes because it's going so fast that my brain is like, and I'm gonna get sick. It's like the room spinning, like the words are just too many things. So I will try to slow down, but I was trying to get back up to the actual ingredient list that I've found so far. Okay, let's look up. Okay, I'm gonna have to cross-reference this list. This is bullshit. All right, let's go here. Share this tab instead. Fludara, drug and food and FDA. Is this the same thing? Yeah. All right, so I need to look. Okay, so we are looking up mannitol. So now I have to look up the ingredients in the ingredients because, yeah, all right. Mannitol is a primary ingredient of mannitol salt sugar, a bacterial growth medium, and is used in others. Mannitol is a cutting agent used in various medications, sugar alcohol isomer of sorbitol, used in pharmaceutical products as a sweetening agent, so it makes the medication not taste like shit. Acceptable excipient for chewable tablets, a toxicity agent, and a bulking agent for lyophilized preparations. Mannitol is industrially derived from sugar fructose. Mannitol is an osmotic diuretic that is metabolically inert in humans and occurs naturally as a sugar or sugar alcohol in fruits and vegetables. That's a problem because it doesn't say which ones, and they don't have to say which ones. Let's look up mannitol. Mannitol coconut allergy. Just was I even close to spelling that right? No, I wasn't. One second. Mannitol. Okay. The anaphylactic risk for mannitol in allergic patients. This is from emjbmj.com. Immediate type hypersensitivity reaction to mannitol. This is from PubMed. That was published in 2015. Okay, this one's from 2024. PubMed. Anaphylaxis to recipient mannitol. Okay, one second. This is PubMed, and this is 2024. Anaphylaxis to excipient mannitol, evidence for an immunoglobulin E mediated mechanism. Anaphylaxis to mannitol present naturally in pomegranate and cultivated mushroom in a sensitized subject has been described recently, and an IgE-mediated mechanism to the sugar alcohol has been proposed. The same subject also experienced severe allergic reaction to a chewable pharmaceutical cisapride medication. So pomegranate. Is pomegranate a latex root syndrome food? Methods. Speed reading. I'm screen sharing on YouTube if you want to look. I would never know that you're losing it. You are gorgeous. I appreciate that. Thank you very much. You are very kind. Okay, let's see. Is mannitol what's offing the patients who are having reactions to this? Mannitol separated from cisapride MPS showed allergenic activity by SPT. I don't know what SPT is. I probably skipped past that. 1 second. Methods. Skin prick tests. Okay. High performance liquid chromatographic analysis of pharmaceutical preparation, separation of mannitol by Ca++ ion moderated cation exchange, chromatography, preparation of alditol protein conjugates by reduction emanation, a skin prick test using the conjugates, hapten affinity purifications of the allergic serum or on D-mannitol keyhole limpet, heomycin and KLH, Cephorose, CL8, CLB6, and detection of serum mannitol, a specific IgE by ELISA. I just totally did the S sound in front of. My brain's forgetting if it's speaking English or Spanish right now, because which is not. I think in English, so this is big, because I just put an A in front of trying to say serum. I said a serum, like Mexicans say Sprite instead of Sprite. Yeah. Okay, so component testing by skin prick tests and other analysis of various pharmaceuticals indicate that the excipient mannitol is a causative allergen. Mannitol separated from cisapid MPS showed the allergenic activity by skin prick test. Among the several conjugates tested by SPT, skin prick test, D-mannitol bovine serum. Thank you. Bovine serum. I will instantly have an anaphylactic reaction to that, because that is this is why I can't do bone broth. This is why I can't do lard, like for like skin moisturization, like a lot of people do when they're allergic to a lot of other things. They just use natural lard. Um, my husband has some in a container, and he was going to use it for a bunch of stuff, and I wasn't even thinking at the time when he first bought it. And I put some. I'm like, I need something for my chapped lips. Guess what I did? You want to know what I did? You want to know? It was dumb. Um, I I put some in a little travel, a little like a homemade, like, a plastic container for putting in your purse. And I was like, I can just use this for, you know, instead of chapstick, I can use this. Mm-mm. The second I put it on my lips, all I could taste was like old rancid beef. It immediately was like, my entire body was like, I was gagging, I was coughing, my face, my eyes were just watering. I looked like I'd just been dumped on prom night. I was getting flushed and swollen, like instant, just everything. And I was gagging, and I got sick, and all these things happened at the same time. And I was like, that was a bad idea. Because yeah. D-mannitol KLH showed positive wheel reaction, demonstrated the presence of cell-bound mannitol-specific IgE in vivo. Negative results with D-glutatol, showed that the mannitol-specific human IgE is very specific to the D isomer of mannitol. ELISA uses the hapten affinity purified allergic serum was positive, demonstrating the presence of a mannitol-specific serum IG in the allergic subject. Mannitol is widely used as a food and drug additive excipient. Can rarely cause IgE-mediated anaphylaxis. This study is the first one to demonstrate the presence of mannitol-specific human IgE in a sensitized allergic subject to validate an IgE-mediated hypersensitivity mechanism for mannitol. Okay, so this is what I think this is what I was looking for. Mannitol. So that's 1 second. Brain. Okay. Corticosteroids, 89. All right. 1 second. We are looking at shellac, other chemo drugs. Mannitol. Where the freak is mannitol? Share this instead. I'm looking for the word mannitol. Oh no, I'm not looking for mannitol. I'm looking for flu, whatever. Fludara. That's the one I'm looking for. 1 minute. There you go. This one. So we're at 887. Coconut. No, wait. Allergens contained within include one second. Need to look at. All right. Look at the 2051 from PubMed. We can do that. I just want to make sure, because this is one I can see an allergist going, "Oh, we should skin prick test you." I'll be like, "No, we should not do that. We should. I can want to skin prick test me for that. Here, let me just put this beef lard right here on my lips, and you can watch me just have get the garbage can ready, and you can have fun watching that happen. Because no, no, I'd rather lick the inside of a tuna can again, and I haven't. No. Mm-mm. Okay. Allergic reactions to mannitol reported rarely. First case report in which oral mannitol induced an immediate type hypersensitivity. It was a drug excipient and a 42-year-old man affected by rhinitis to olive tree pollen. I can do olive oil. I can't do olives. So that's probably one of those like histamines are filtered out in the process, like when making. Sorry, when one second. Yeah, I know I spelled that wrong if you're watching on YouTube. What is mannitol made of? Mannitol occurs naturally in mushrooms, marine algae, strawberries, celery, pumpkins. Every single one of those. Okay, let's see. Mushrooms are going to be high in histamine and they're a nightshade. Marine algae, I have to look that up. Strawberries, celery, onions, and strawberry, celery, and pumpkins are all latex allergy fruit syndrome crosses, according to the Allergy and Asthma Network. Mannitol, adding hydrogen to fructose, derived from starch, corn, latex allergy cross, wheat or tapioca, latex allergy cross. Okay, that's what I needed. Okay, so this is, let's go finally. How long did that take? Way too much fucking time. That's what it took. Hi, Fit Today. And Homestead Donegal, how are you? Hello, Laurel. We just had, that was okay. Allergens include wheat, tapioca, celery. I'm just going to put and other latex fruit syndrome cross reactives when derived from latex fruit syndrome cross reactives. I'm just going to leave it that way. Yeah. Okay, let's look here. Pomegranate and cultivated mushroom. Is pomegranate done? Latex food syndrome. In the UK, it's latex food syndrome. In the US, it's latex fruit syndrome. So if you see either term, it's the same thing. And it's always good if you have latex allergy or latex food or fruit syndrome and you're either in the UK or the US, it's always a good idea to check the sources from the opposite continent, right? Because they have things listed on UK sources that are not listed on American sites. Want to see? 1 second, YouTube, if whoever's watching, I'm gonna show you. Right there. This is what just took me an hour and a half to find. Latex food syndrome Mannitol is derived from either mushrooms or pomegranate, right? Those are the main sources. Pomegranate allergy is seen in conjunction with allergies to other foods presenting as latex food syndrome, which is caused by the body confusing the proteins it encounters in food to that of latex proteins, which is already sensitized. Thank you. Done. Right there. So people who are allergic to latex need to be careful because and my body just said, I'm hungry. All right, so let's just go back over here then. And how many medical degrees did I just earn? Hi, Tomasz. Yeah, I'm still here. It took me an hour since you were here. I think I was still researching fludarabine, trying to figure out why like it has such a high. The warning list reads like, so if you take this, you're probably going to explode. And the three main reactions or results are like coma, seizure, and a funeral. And I'm like, why is that so high? Because I'm only seeing. A minute. A minute. One minute. I had to verify. All right. Mannitol is usually derived from mushrooms or pomegranate. There. I just wrote a paper on one freaking fludarabine and fludara. Allergens contained within include wheat, tapioca, and other latex fruit syndrome crosses. Reactives, mannitol usually derived from mushroom or pomegranate, latex syndrome fruit list trigger. All right, so that's why that is. I don't. Oh, here, share there. Now you can see it if you're on YouTube. All right, now we're looking. Please don't let this be. Thank God I'm not even going to look up. I still have how many? Good Lord. Okay, I have to take a 5-minute break. I'll be right back. I'll have to pause, so I'll be right back, okay? I have to go to the bathroom. I got like 3 more.
I think I'm just gonna go upstairs and chill while I'm asleep. I put the dishes away. I haven't put anything into the dishwasher because I was tired.
That's fine.
And also I fed the gecko. I'm not correcting those.
I did. Good job. Thank you. I'm just trying to. I didn't know. I'm glad I started this tonight because that one alone. I have a lot.
Yeah, that one was that I haven't heard you say that one before.
I'm like, how the fuck? Why is that so hard to find? That one, like, it says like, yeah. So this one, seizure, coma, death. But yeah, here's an option for treatment.
Yeah, that's wild. That's absolutely insane.
Text me when you get your phone and tell me if any of my chargers are
I moved all of your things into your room.
including see that?
That's one of the things.
I was just making
That's
sure.
like your most obvious thing.
I was just making sure because I'm not sure. I wasn't sure which room I was going to when I went upstairs. Okay.
Hello.
And I'm back. Okay, this doctor's gonna fucking hate me. He's gonna hate me. And by this I mean whichever doctor is the one that is I'm sent to for the blood cancer crap. Mhm. Yeah, okay. Let's see. Please let that have been the only like hiccup in trying to research crap. Let's just make this easy, please. Share this tab instead. If you're still here. Yeah. Ingredients. All right, claritamine tablets. We are looking FDA.org. Share this tab instead. All right, Lustatin, cladribine injection. Suppression of bone marrow function should be anticipated. My ears acting up with one of the conditions I know I have that I haven't been diagnosed with yet because it usually appears with Behçet's disease. But but the resident was like, "No, you've got like the visible symptoms, but you don't have that." And it's like, sure. Anyway, serious neurological toxicity, including irreversible paraparesis and quadriparesis, has been reported in patients who received the injection. That's nice. Yeah. Okay, description. Okay, so it contains 1 milligram of the active ingredient, lustatin, right? And 9 mg of sodium chloride as an inactive ingredient. The solution has a pH range of 5.5 to 8. Phosphoric acid and or dibasic sodium phosphate may have been added to adjust the pH. How toxic? Like, I get it that like I get that like you need the toxicity of you're trying to get the bad and the bad, so you need sometimes you have to use the bad to get rid of the bad, right? Oversimplification, but this is crazy. This says, according to this, from FDA.gov, this is an intravenous medication, and it's very small. Like it's like a 3-ingredient list. What is lustatin? Okay, well, fine. We're gonna look. Okay, because it says lustatin contains 1 milligram of the cladribine, a chlorinated. I'm allergic to chlorine. Ethylene hydrochloride, a chlorinated purine nucleoside analog. Each milliliter of lustatin injection contains 1 milligram of the active ingredient and 9 mg of sodium chloride as an active ingredient, inactive ingredient. Okay, so then phosphoric acid and or dibasic sodium phosphate. What is dibasic sodium phosphate? Inorganic compounds. Chemical additive foods, cosmetics, other products, useful as a preservative and a flavor enhancer, among other things. Ethylenediamine dichloride is used as preservatives. Wait. Sodium hydroxide. Let's see. Chloride. So chlorine. So I know chlorine is in there. Chlorinated. Dibasic sodium phosphate ingredient allergy. Free of no, not that. Sodium phosphate is an umbrella term that refers to multiple combinations of sodium, salt, and phosphate, an inorganic salt-forming chemical. Food-grade sodium phosphate is recognized by the FDA as safe for consumption, often used as an additive in processing food manufacturing, and also used as an ingredient in many household products and medications. Uses a preservative and flavor enhancer. We're just going to go with chlorine. We'll just go chlorine. That's the easiest, because, I mean, I already know. I can't get into a swimming pool, okay? If I can't get into a swimming pool, I can't take something that contains one of the reasons I can't get into a swimming pool, other than the fact that swimming pools are basically latex soup. Share this tab instead. So I'm at 888 for allergies. Cladribine is one of the chemo options for treatment, and I found that one in 5 minutes, I think. contained So I'm typing right now. Allergen contained within contains allergic triggers contained within includes chlorine, which is made with. Which contains. I can't spell this now. All right. Okay, so, okay. All right. So that's 888. 889 is corticosteroids. Entire class of this drug contains ethylene dimethyl chloride, and colchicine is made from crocus flower, which is a natural rubber tree family member and latex allergy trigger. Prednisone, so all of corticosteroids just are out. Okay, other chemo drugs. Last three. Oh my God. Hi, Squirrel fan. How are you? Hi, Jill. Other chemo drugs. Let's three more to look at. And then I'm done for thought processes tonight, this morning, whatever. We gotta get the dogs outside before it starts storming. Because if the wind gets as bad as it says it's going to, my 6-pound Pomeranian is going to be a kite. Should this tab instead? We are looking at I know I can't spell right now. I can't see it. 1 second. There we go. Okay. All right. One minute, making sure that's the right thing. Biscatrin, vincristine, Oncoin. Did I spell that wrong? What the hell? Yeah, I did. Okay, 1 minute. Sorry. Vincristine. Ingredients. PubMed. Screen sharing on YouTube. All right. This is episode 3, I think, for the rabbit hole research for my allergen list, which I am now trying to stupid proof in preparation for treatment option discussions, whichever doctor I am sent to for that, for the macroglobulinemia, which is chronic blood cancer, slow progression, not curable, treatable. And I've already done episode 1 and 2, I believe. I believe this is 3. If it's 4, I'll renumber it when I look tomorrow after it's uploaded as rewatch. Because right now I'm live streaming it. Okay. On YouTube. Okay. Okay. Wait a minute. What? That is not what I spelled. Is that what I spelled? I spelled that wrong. My collagen has clocked out. My ear. I have collagen. My connective tissue disorder. My connective tissue is not connecting. All right, let's do this again. Christine. And Christine. Vincristine is a vinca alkaloid derived from the Madagascar periwinkle that is used to treat various types of cancer. Okay. It works by stopping cells from dividing properly. So like the wrong kinds of cells from dividing the way they do. What is vincristine derived from? Vincristine is a member of the vinca alkaloid group, which consists of organic compounds composed of carbon. I'm allergic to carbon, hydrogen, nitrogen, and oxygen. These compounds are derived from the periwinkle plant Cantharanthus roseus, formerly known as Vinca rosea. All right, that's from Stat Pearls. Thank you. See, this is how drugs.com. Take note. Do it that way. Okay, so first we go to here. Vincristine. I'm gonna drop this. Okay, I share this tab instead. All right, again, I am sharing screen sharing on YouTube. So if you want to hop on Chronically Spicy, I'm trying to get to 1,000 subscribers on the channel because right now, shit. Lightning starting. Okay, I need to get the dogs out soon. 1 second. Lightning's in. Lightning within. Allergens contained within include carbon, ethyl, and a diamine. Dihydrochloride. And then I need to look up one more thing, and that is periwinkle latex allergy. Keen to see. Periwinkle allergy. Sometimes it's the search terms that you use. It's like you have to figure out how to ask the question. Because I wouldn't have known that I'm allergic to stevia because stevia is in the same family as ragweed, and ragweed's in the same family as the Dutch rubber tree. Or that I'm allergic to monk fruit because monk fruit is usually derived from gourds, and gourds are a member of the natural are listed on the Allergy and Asthma Network latex fruit syndrome cross list because they share similar proteins. All gourds. contain similar proteins with latex, your body can confuse one for the other. So, like if I'm having a slice of pumpkin pie for, Thanksgiving, I could potentially have anaphylaxis or worse if my body suddenly decides, oh, this is latex. So far, I'm okay with pumpkin, but I have to be aware of what is potentially going to trigger a reaction so I can be prepared to fix and counter with rescue meds. Is there at least no? I don't know that. Okay, you're not answering my question. All right. What plant family is periwinkle? I wrote periwinkle last time, I think. Periwinkle flowering plants in the family Apocynaceae. Catharanthus. Okay. Let's look up Apocynaceae family. Like, this is how I found out that bamboo is a natural rubber tree relative. Because I was trying to figure out why I reacted after I used. I was wearing a shirt made of clothing from bamboo, and that wasn't fun. What's going on here? Is this 9? Might be. So we're just gonna go without for now, right? Because I did not plan to make this an all-nighter, but I have until Tuesday to get this done. And I don't know how long I'll have internet after storms start. One second. Okay. Haha. Oh my god. Okay. You know how gamers pull all-nighters and stuff, and people are like, yeah, let's watch the whole stream. You're still here if you're like a knowledge nerd like I am. Okay, so this is all I need right here. Landolphia oriensis. Landolphia oriensis is a species of liana, the family Aponaceae, found in tropical. I might have pronounced that wrong. Apocynaceae. Found in tropics can be extracted from this plant for the manufacture of natural rubber. So periwinkle is in that family. So that means no. Because the rubber tree itself is in the Havea brasiliensis family. Yeah. Latex bearing plants are found in 20 botanical families. The most prominent families include Sapotaceae, Moraceae, Compositae, Apocynaceae. Okay. It's a natural rubber tree containing family. Okay. That's what I need. No. Okay. Bisitrin. Christian. Share this one instead. Carbon. All right, so I just wrote vincristine, also known as oncovin. Allergens contained within include carbon, which includes ethylene chloride, and is derived from a flowering family containing natural latex plants. This doctor is gonna fucking love me or be like, why did they put my name on this list? Because why do I deserve this? Like, I'm sorry. All right. Doxorubin, right? Yeah. Here we go. Lactose, methylparaben, sodium chloride. 1 minute. All right. Sterile cytotoxic agent. No. Doxorubin shows okay. It's sideways. Doxorubicin hydrochloride. Anything that ends in hydrochloride always makes me nervous because ethylenimine dichloride. But the hydrochloride means it's two chlorides. Hydrochloride is one. Whatever. USP equivalent to 1 mg. The pH of the solution is adjustable. All right. So I need to see what doxorubicin is derived from. Oh. Doxorubicin is an antibiotic derived from the Streptomyces pusitius bacterium. It is derived from the hydride of a tetrazine. The ampicillin class of agents. 1 minute. I'm going to apologize now for a second because I have to chew a piece of ice because it's been a while. See, I just chewed one. I'm being nice. This is not helping. Mm-mm. Mm. Mm. All right, it's not helping, so all right, according to this, it's usually used in solid tumors, especially breast cancer, sarcomas, and lymphomas. For doxorubicin, immediate hypersensitivity reaction to pegylated liposomal PEG. There. Coconut. PEG-elated liposomal doxorubicin. Doxil has been using cancer chemotherapy for 16 years. Clinical experience shows that it can cause mild severe hypersensitivity. It's because PEG is polyethylene glycol. Polyethylene glycol is derived from coconut. There we go. Polyethylene glycol derived from coconut. All right, so that is, 1 second, 889 was corticosteroids. Vincristine is 890. Doxorubicin is 891. One left. And then I'm done for tonight, this morning, whatever. There. So just doxorubicin right there. Screen sharing on YouTube. Okay, so now I'm just picking random. But I did not eat much yesterday. It's still today until I've gone to bed. Seriously. Wait, what? Adriamycin, doxorubicin, hydrochloride injection. If it contains doxorubicin, then I can't, then no. Because that we just did doxorubicin, which is derived from or contains PEG, which is polyethylene glycol, right? See, it says so right here. Okay, so let's find the article that I was on. Let's close this one because I gotta find the article I was on. Hell. Here we go. Right here, Daily Med, andriamycin, doxorubicin, hydrochloride injection, April 11th, 2024, Daily Med, NIH.gov. Inactive ingredients. Well, I'm just going to be all right. Coconut. Oops, share. There, screen sharing. Catching up with the screen share. Dosage and contraindications. Warnings, adverse reactions. Drug interactions. Overdose description. They all say doxorubicin. Doxorubicin that's a no. Ingredients and appearance. Intravenous. Doxorubicin hydrochloride. It's just a different name for the medication. Doxorubicin. We are not skin testing for this. because coconut is bad for me. PEG. Okay, so a second. Here we go. So andromycin 892. Doxorubicin, which is made with shares, since I haven't said, made with PEG, polyethylene glycol, there. Mother of freaking God. We are at 892. That was all of the, that was every single option for chemo. Everyone. Delete. Okay. I need to, oh my God. All right. Closing some tabs, y'all. Closing some tabs. Okay. I forgot to look at that. All right. So then what's the next one we're going to be looking at? Not today. Symptom causes treatment. Let's go back down here. All right. So just looking. By the way, symptoms of the Waldenstrom macroglobulinemia include weakness and fatigue, fever, loss of appetite, night sweats, weight loss, confusion, enlarged liver, spleen, arrow influence, signs of peripheral neuropathy, tingling sensation in your fingers and toes, signs of thickened blood, nosebleed, bleeding gums, dizziness, headaches, and blurred vision. There's a gene mutation that's involved in 90% of these cases. Not hereditary, but there are cases of familial, so also hereditary, but not. Complications can include ceruloglobulinemia. Condition happens when certain blood proteins that react to cold conditions gather in clumps in your hand and feet, causing pain and turning your hands and feet blue or white. My hands look like they were drawn right now by like a comic book artist. You can see the fine lines are like, look like I've been playing in dirt and gardening. I haven't. It just happens when my Beichetz is, Beichetzian. Okay. All right. So we've already looked at chemo. Okay. So options include watchful waiting if you don't have symptoms. I have fibro and EDS and mast cell activation syndrome. I don't know. Plasmapheresis, plasma exchange. Providers use a machine to filter abnormal IgM from your plasma, the liquid part of your body, the return of plasma to your bloodstream. Providers use this treatment to ease symptoms caused by thickening in blood. Immunotherapy, rituximab, alone or with chemo. Chemo, corticosteroids, targeted therapy, such as Brukinsa, I'll look that up. Stem cell transplant. Okay. So let's look. I just want to make my next. I have to look at plasmapheresis. So I have to just build on this. 1 second. Okay. Am I still screen sharing? I forgot. Okay, 1 second. It's okay. Nobody's here right now. Okay, so oh no, you are here. Thank you. All right, cool. Because this was not. I wasn't planning on being here this long. Here. Share. Okay. Next. Rabbit hole research. What the hell? All right, plasma exchange. What to look forward to on the next episode of Rabbit Hole Research. Where's my list? Okay. Immunotherapy. Let's get rid of this one. Let's get rid of. No, that's fine. All right. Immunotherapy. Where's my. There we go. This. Yes. Okay. Immunotherapy. All right. Where'd you go? I have too many. This is a lot of tabs. Close. Where's my list? One second. I'm almost done, I promise. No, we're not looking at that right now. No. Flutara, no. Flutara no. Not hot. Where did you go? For serious. Oh, here we go. Thank you. Okay. So plasma exchange, immunotherapy, we already did chemotherapy, we already did corticosteroids, targeted therapy, blocks cancer cells used to make more copies, ibutranib, Embrivica, and all right, I'm just copying this. I have 3 options left. I was like, copy, go here. There we go. So next option, sorry. So the last research options on here are going to be plasma therapy, plasma exchange, immunotherapy, targeted therapies, which include treatment blocking proteins that block cancer cells to make more copies, including ibutranib, Embrivica, and zanubrutinib, Brukinsa, both targeting therapies approved by the FDA to treat Waldenström macroglobulinemia. Stem cell transplant. Providers replace bone marrow affected by abnormal cells with healthy bone marrow. This is uncommon and used only in select people. I wonder if I am select people. I also might fit in the watchful waiting category right now because I don't know if symptoms, because I was diagnosed about 20 years before the average person is diagnosed. Um, I might still be in the watchful waiting category on this one. That's another option. Like literally just let's just keep an eye on it and see what happens. So, all right. Um, 1 second. All right, I think we're good. I mean, we have to be. It is 5:30, 4:34. It is 4:34. I have to walk the dogs for potty, not for like, hey, we're gonna go for a walk and have a good time right now. No, no, we're just gonna go potty. Um, and get in, get a few hours of sleep. Um, I'm ADHD and like an MFR right now because that was a lot. I was just, how much would a doctor have made in that 4 hours and 20 minutes of research? How much would a medical researcher have made in that time? Like, what's the hourly pay range? Because I'm pretty sure I earned it. Okay. All right. I am obviously glitching right now because, wow. And we're going to go now. I want to thank everyone who has stuck around with me while researching options for a chronic blood cancer that I was diagnosed with in August of 2024 at the Mayo Clinic and was not told about when I was still there. I was not called about it. I was called and told that I had Behçet's disease. The same lab draw, I believe, from the doctor or the resident who ordered and diagnosed the testing and the condition for Behçet's disease. I believe it was the same lab draw. I can look at the papers and confirm, but I was not told. I was not even told that I needed to, talk to my doctor about concerning abnormal labs. It could have been as vague as fucking possible and just passed the buck on to the next doctor and just said, hey, yes, you have Behçet's disease. That's the condition you came in asking about. But you also had a couple of other abnormal labs. We would highly suggest or recommend that you take your lab findings from your Mayo records and get that information to your regular team of providers and see what they'd like to say. Like they could have completely sidestepped the entire big C, and you might have, or you do have, because they actually wrote the words and the diagnosis and everything. They could have completely bypassed all of that and just been like, hey, something you need to talk to your doctors, okay? Because you're no longer our responsibility. You're leaving the state in 2 days. Going back to the Midwest. They didn't do that. They didn't tell me. I left Mayo Clinic again because I want to make sure people understand this. It's not like I didn't look at my records. I've been staring at my records almost daily for the last 8 months, trying to like narrow things down and figure things out to try and find the right doctor in this area because Wisconsin and Minnesota do not like even recognizing mast cell activation syndrome. And fibro, EDS, all that stuff, right? But are connected to that, and I've been trying to figure out what doctors to talk to, find this, that, whatever, with the complex medical history. So I've been going through my records left and right. I'm in them almost every other day, but I never looked at, like, yeah, I know I'm low in my vitamin B. I know I'm low in iron. I can't take anything chelated. Like, I knew there were abnormal labs, but that one didn't stick out to me. I didn't see it. I didn't see it because I didn't know that it was like a bad thing. I wasn't familiar with the term. No one said you have to talk to your doctor or your doctors, or we would suggest looking for a hematologist or an oncologist when you get home, because your lab tests showed that you also have a form of lymphoma. And right now it might just be a just watch and wait and see, because it was diagnosed early. The average person is 65 when they're diagnosed. But they didn't say anything at all. So I quite literally left the Mayo Clinic in Jacksonville, Florida, as a patient there for most of 2024, 2023 to 2024, without being told that I had diagnostics proving and showing labs for a diagnosis of that was made in my records stating that I have a chronic form of blood cancer. And that was thunder. So I'm going to take the dogs outside now. Stay safe, and I will check in as soon as I can. Thank you for watching. All right. 1 second. Have a good night.